Well, welcome everybody. I believe we're going to get started. We have a few other colleagues running a few minutes late, but we have quorum. First of all, welcome to the meeting 4 of the Board of Health, and welcome to members of the board, to other members of council in attendance today, and to members of the public. This is the second meeting for many of us. For those watching online, you can follow the agenda and the debate on your computer, your tablet, or your smartphone at www.toronto.ca/council. And the Board of Health acknowledges the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the New Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. As we begin, are there any declarations of interest under the Municipal Conflict of Interest Act? And I'd note if you have any now, we have to submit them in writing. All right, seeing none, I'm going to begin with moving a confirmation of the minutes from February the 25th, 2019, moved by Councillor Lai, seconded by Trustee LaPreti. All those in favor, opposed if any, carried. All right, and we also, I just note I have a motion that the Board of Health excuse the absence of Ashna Bowery from the meeting of April the 8th, 2019. Ashna, unfortunately, her grandmother passed away yesterday, and she has had to fly to Vancouver at the last minute. And so I will place that motion to excuse her absence. Could I see all those in favor, opposed, if any, carried? Councillor Perks will be here in 5 minutes. Thank you, Mary. All right, we're going to begin the agenda, but before we do, and we move into the agenda, I'm going to turn it over to our Medical Officer of Health for a few remarks and an announcement.
Thank you, Mr. Chair, and good morning, members of the board. I would like to take just a few moments of your time on today's agenda to update the board on an upcoming change to our senior management team at Toronto Public Health. Jan Houston, who's sitting right over there, our current Director of Strategic Support, recently announced that she will be retiring from Toronto Public Health, and her last day with us will be the 26th of April, which is, sadly for us, just around the corner. So this is Jan's last Board of Health meeting, and I would just like to take a few minutes to thank Jan for her significant contributions to public health, to Toronto Public Health in particular, and all that she's done in her many years of public service. So by way of background, I think you should know that Jan began her career as a public health nurse with the city in 1985. And we have been very, very fortunate to benefit from her dedication and her expertise since then. During her time at Toronto Public Health, Jan has provided leadership. I think she's actually pretty much run every directorate at Toronto Public Health, almost. And she probably feels that as well. But just to give you a sense as to what her impact has been, how many directorates across the organization of Toronto Public Health she has been involved with and influenced. Communicable disease control, planning and policy, chronic disease prevention, healthy communities, and in the last several years, strategic support. But throughout all her involvement in Toronto Public Health, her consistent efforts towards addressing the social determinants of health have led to innovative public health initiatives and practices throughout our city. She has also contributed a significant influence on the direction of public health locally. Most recently, Jan provided leadership to the Toronto Overdose Action Plan and was instrumental in our ability as Toronto Public Health to establish supervised consumption services in this city, a subject on which we're going to have further discussion at this very meeting. On a very, very personal note, Jan has been absolutely invaluable to me as a colleague over the last 2 years as I've taken on this position. She was the person who welcomed me in my first day at the office. She guided me through pretty much everything. So everything that we have done successfully, I should say, in the last 2 years simply could not have been done without Jan Houston. She is truly, I don't want to get overly emotional here, so I'm going to try to restrict the remarks here. I really cannot thank Jan enough for creating, the conditions that allowed me to be successful in this role and to allow others to be successful as an organization. Jan, thank you. Board of Health members, Jan Houston is truly an exemplary member of the Toronto Public Service and one of the finest public health practitioners I've had the pleasure of working with. So on behalf of everyone at Toronto Public Health, Jan, we wish you the very, very best in your richly deserved retirement. And we want to thank you for your contribution to the city, to this board, and to each of us at Toronto Public Health in our professional capacity, and I can say in our personal lives as well. We hope that the next chapter finds lots of gardening, lots of bike riding, lots of travel, all the things you enjoy, time with your family. We will miss you. Advocacy may very well figure in prominently in between. Now, let's be fair to Jan. She should have plenty of time in her garden and on her bike. And in between gardening and, right? Absolutely, absolutely. I suspect we have not seen the last of Jan in the public health policy realm. So please, I would ask you to join me in thanking Jan for her many, many contributions to public health and in wishing her well as she embarks on her next chapter. Thank you. Jan. Thank you, Mr. Chair.
Well, listen, I am not going to follow on that, but I will only, in echoing some of Eileen's comments, say that in my brief time at Public Health over 5 years, I've had the privilege of working with many of the city's best, and none more so than Jan. That on one file in particular, above every others, on overdose, in community settings, in a tent down in Moss Park, in the mayor's boardroom, and with the Minister of Health provincially. At all times, not only was Jan, I can tell you sincerely, strategic and thoughtful and effective, but caring always. And that is the embodiment of public health, which is strategic, effective, but caring. And so, Jan, I'm actually, before we formally begin the meeting, do you want to say a few words? Yeah, here, come take my chair. No, okay, over there.
Thank you, Councillor Cressy and Dr. Davila. Your words mean more than I can express. I just wanted to say that I chose to become a nurse and work in public health because I wanted to make a difference in people's lives. And I could not have imagined 34 years ago the issues that we would be dealing with, such as HIV, the resurgence of TB, overdose, homelessness, climate change. And the small part that I've played in addressing some of these issues over the years has really been because of the many skilled and dedicated colleagues that I've had the pleasure of working with, including past and present medical officers of health and chief nursing officers. And in particular, over the past 5 years, in my current role, I've worked with an exceptional team of staff, some of whom are sitting behind me today, and others are back at the office keeping things going. And in their role, supporting actually the regular reporting to the board. But we couldn't have made the impact that we've had at Toronto Public Health without all of you as our governing body. And I believe Toronto Public Health, Toronto's Board of Health has been and continues to be one of the most progressive in the country and has been a leader in policy change that will have a significant and positive impact for the lives of people in Toronto and actually I think in the province because you've really led policy provincially as well for many years to come. And it takes great courage to challenge the status quo, and through the years, our Board of Health has consistently shown that courage, and it's meant so much to me as a civil servant to be part of a leading public health organization supported by a board that takes such bold action to implement change. And finally, one of the things I really appreciate is being able to support the democratic process that enables the people of Toronto to have a voice and speak out for what they feel should be done to make the city a healthier place for everyone. And in particular, I want to thank the past and present chairs and vice chairs of the Board of Health for enabling everyone who comes to speak to the board, including those who often don't have a voice, to speak and be respectfully heard by our board. So it's for these reasons that I have, and I know I will continue to say, that I'm really proud to have worked for Toronto Public Health and the City of Toronto. And thank you again for your kind words and for supporting the work for all of us at Toronto Public Health. So thank you.
Okay, and as a last parting gift, we're going to make sure that we send controversial items to council for Jan to be put on the floor to answer later this month.
Our retention strategy?
That's our retention strategy. So members of the board, your yellow sheets here, we're now going to go through the agenda. Our first item is item 4.1, heat relief service update. I believe there's a presentation on that, so we're going to hold that down for the presentation. Our second item, Ontario's government, is 4.2, Ontario's government proposed changes to provincial healthcare system. I'm going to hold that down as I have some questions. Others may as well. Item HL 4.3, addressing vaccine hesitancy. We have speakers registered on that item. And again, for members of the board who are new, on your green sheet, it has a list of deputants who have registered to speak. So we'll hold that down for speakers. Item HL 4.4, health impacts of alcohol consumption update. We have a registered speaker on that item, so it will be held down. Item HL 4.5, disclosure of infection prevention and control inspections of licensed child care centers in Toronto. Are there anybody wish to hold this item? Seeing none, Councillor Layton, would you like to move the recommendation? Recommendation has been moved. All those in favor? Opposed, if any? That carries. All right. Item HL 4.6, appointments to the Toronto Food Policy Council. In your confidential materials, the list of names are on there. There are no speakers on this item. Does anybody wish? Okay. Councillor Wong-Tam is moving it. All those in favor? Opposed, if any? Carried. Congratulations to the new members of the Toronto Food Policy Council. I discovered I was one of them when I opened up the list. It's good to know. HL, I'm very excited. HL 4.7, City Council approved Toronto Public Health 2019 operating budget. There are no speakers. Does anybody wish to hold this item? Seeing none, I will move the item to adopt the recommendations. All those in favor? Opposed, if any? That has carried. HL 4.8, City Council approved Toronto Public Health 2019 to 28 capital budget and plan. There are no deputants on this item. Does anybody wish to hold it? Seeing none. Trustee Donaldson, would you like to move that? So moved. All those in favor? Opposed, if any? Carried. It's better when it was the former chair, Councillor Mihevik. He just said thank you for moving it without asking. So this is an improvement. There is one item of new business that has been added on the pink sheet. It is a letter from myself related to the overdose crisis. As well, the medical officer of health has prepared a presentation on this, which we are proposing to join those two items together. So we need a motion to introduce that. Trustee Donaldson, all those in favor, opposed, if any? Carried. There has been, we've gone through the agenda. There has been a request to deal with item 4.9, the new business item first, and to allow the medical officer of health to give a presentation. Are people comfortable proceeding in that way? Yep. All right. So we will then proceed back to the beginning of the agenda, but we're going to begin with the presentation. So this is the pink letter you have in front of us that we're dealing with now, and we're going to begin with a presentation from Eileen.
Okay, thank you, Mr. Chair. And thank you, Jan, for being the slide changer over there. And we do have other members of staff who are prepared to help in terms of addressing questions should you have any. So I will take you through this very brief presentation seen on the screen in front of you, opioid poisoning crisis update, and you may have hard copies in front of you If not, I would direct your attention to the screen. So first, by way of update, on March 29th, the province did announce approval of 15 consumption and treatment services across Ontario, 6 of which were located in Toronto. By way of background, just remember that supervised consumption services first made their appearance in our city back in August of 2017. When the current provincial government was elected, they indicated and they went ahead with a review of the model and put forward in the fall of last year this notion of consumption and treatment services. All existing sites, whether they were supervised consumption services or overdose prevention services, were asked to apply under this new model. Our service here did apply along with all the others, and we're about to go through that, which happened. We have 15 consumption and treatment services that were approved by the provincial government under their new model on March 29th. 6 of those were in Toronto, as I said earlier. 2 services of those who applied in Toronto were not approved, and these were the services that were located at Street Health and at St. Stephen's Community House. Unfortunately, the announcement that came from the provincial government in regards to those services effectively saw the immediate cancellation of funding to those services. These were 100% provincially funded services, and no time was really available for transition plans or any kind of, smooth transition from operating to non-operating. There was just simply no time or opportunity that was afforded in that regard. These 2 services, though, we have been in regular contact with since the 29th of March. They are continuing to operate in the short term. They do have federal exemptions which allow them the legal authority to continue to operate. Their challenge now has to do with funding. One of the sites that was not formally approved as part of the March 29th announcement that was made by the provincial government was our supervised consumption service that's operated by Toronto Public Health at the Works. We were advised that our application is still under consideration or under review, and in the meantime, while that review period continues, that funding would continue. 100% provincial funding continues in our to support our operations. Next slide. Unfortunately, this all comes at a time when the situation continues to be extremely urgent in our city. You will have heard me refer to the current opioid overdose crisis as the defining health crisis of our time. And I regret to inform members of the board that the situation continues to be extremely urgent and quite dire. In fact, there's been a recent surge in overdoses just this past month, and some of the figures are articulated here on this slide for your, just for your information so that you're aware of what the circumstances are. So in the month of March 2019, that month saw 474 calls to our colleagues at Toronto Paramedic Services. And this is over 100 calls more in a given month since September 2017. So we're talking about very high numbers of calls to paramedic services. When we break down those 474 calls, there were 452 non-fatal calls and 22 fatal calls. Looking just at the last week of March alone, there were 125 calls. The greatest number of calls in 1 week for the year this far. Most of the calls are occurring in the downtown core, the area which has been noted to see the highest activity with respect to opioid overdoses. And when we look at our service provision in particular, at our supervised consumption service at the Works, we saw in the month of March 3,745 visits, and amongst those visits, saw 66 overdoses reversed. This is the greatest number of visits we've had to our site in 1 month by far. We don't have all the answers in respect of the surge, but we do believe that the toxic drug supply is clearly one of the key factors behind that which we're seeing in terms of these numbers. So I did want to make sure that you had that information for you, available to you, to understand that which is happening in our community. I wanted to make sure that the board was aware of the decisions that have been recently taken by our provincial government and the implications that that has, first and foremost, for those in the downtown core, clients of our service, I would say our community writ large, and obviously our organization and the particular service that we provide. So with that, Mr. Chair, I'm going to wrap up the presentation. Happy to take any questions that the members of the board may have.
Thank you, Eileen. As this is a new item, we didn't have any registered deputants. Is there anybody who wishes to speak? For members of the public, if you wish still to register to make a deputation, you can connect with clerks to my right. Are there any public speakers to this item? Okay, seeing none, we're going to bring it into committee. At this time, and there is a letter in front of you with recommendations on the pink sheets that you have. Are there any questions for city staff and the medical officer of health? Peter.
Thank you, Dr. Javella, for your presentation. I was just wondering, compared to the other supervised sites, how active is the works, and how are we going to actually manage if we actually lose funding to this site?
Through the chair, thank you for the question. I can tell you that the site, our supervised consumption service at the Works, is the busiest location in the city. We are also the largest. So not surprisingly, we do have the largest volume of visits. I can't speak specifically to the numbers of the other services, but I know that our fellow service providers have been in active conversation. I know that they're concerned about the loss of service that was communicated and is the result, or that might result, if the services can't operate any further. So the two services that were on the not approved list are continuing to operate, but for how much longer they can operate without provincial funding, they need stable sources of funding. I don't know how long they can manage. They're actually in the process of working that through. But I do know that those who are continuing to operate, those who were approved under the consumption and treatment services model, are concerned about their ability to fill in. And I think the other issue is that we have to think about the location of services. People will not move. We determined that through studies. We did a supervised consumption service assessment study. People can only go so far in terms of accessing the service. Without services being located in the places where clients actually need those services, people will engage in unsafe practices. And I think that fundamentally, that will lead to a greater number of deaths in our community. And that's the unfortunate reality of the decision that's been taken thus far.
Thank you, Peter. I have Trustee Donaldson and then Councillor Lai.
Thanks. I'm happy to see that we're going to be engaging the federal government on support for this, and I'm just wondering, is there any precedent in any of the other cities in Canada for the federal government engaging?
So through the chair, the federal government is in active conversation. I don't know that there is a specific precedent for, there have certainly been measures taken by the federal government to facilitate access to exemptions to secure the legal authority to operate. With respect to funding, outside of specific research channels, there has not been direct funding for that kind of service to my knowledge. However, I understand it is the subject of active conversation at this point in time.
Thank you. Councillor Lai.
Through the chair, are there any specific reason why these two sites locations were not approved by the province?
Through the chair, I've had the opportunity to speak to the proponents, the executive directors, both of Street Health and of St. Stephen's. They did receive some rationale. I'm not sure that it's entirely appropriate for me to share that rationale. I'm happy to perhaps have an offline discussion, once I've had the chance to speak with them. I don't want to answer their questions for them. I think that they would be willing to come and speak to members of the board around that which they heard. But
Okay.
suffice it to say that they were provided some rationale. I'll leave it to them to discuss with you what they did hear from the provincial government.
Well, through the chair, just a further question on that. I just wanted to make sure that, if we're going to request it, would they turn down again, or is it any point of reapplying for that site?
So through the chair, my understanding is that the subject of reapplication was raised, and they were encouraged to not reapply for their existing locations.
Thank you.
Thank you. Any other questions? Okay, seeing none, we're going to move into speakers. To speak? Okay, I'll put myself forward to speak to begin. So I will move the recommendations in the letter in front of us. I think very briefly, because we are dealing with the issue of overdose on every meeting of this board. And again, an update on the overdose action plan will be back once again next month. If this was anything else other than drugs, governments would not be shutting down life-saving healthcare. If this was any other cause, if this was cancer or an outbreak of a preventable disease, if this was SARS, or if we were having the same number of deaths from a fatal airplane crash every month, they'd be grounding those airlines. But it's drugs. And so for some reason, that stigma continues to drive a bad policy agenda. And so the manner in which this decision was made was wrong, to shut down sites on a Friday afternoon, to tell them that they cannot open on Sunday night with no transition plan. The manner in which this was done was wrong. The evidence behind the closure of sites, when all the evidence says that we should be opening additional sites, was misguided. And I can tell you that the opportunity here is certainly for the province to still reverse course and do the right thing. They reversed course on autism. They reversed course on the appointment of Ron Tavener. They reversed course on the Greenbelt, and they can still reverse course on this. And I know that our mayor as well has formally requested them to reverse course and met with Christine Elliott to request them to reverse course. And so I think it is incumbent on us to continue to push that. But I also think it is equally incumbent on us to initiate those conversations with the federal government, because while it is the province's responsibility to fund life-saving healthcare and all healthcare, as the City of Toronto and the federal government, I think we have a moral obligation to step in if the province will not. And so it's important, I think, that we initiate those conversations as well. And with that, I will move this motion. All those in favor? Any opposed? Seeing none? Carried. Unanimous. Thank you. Okay, we will now move forward to item 4.1, Heat Relief Services Update. And it has been held for a presentation, and I believe a presentation has been just circulated around, so you have a physical copy.
So through you, Mr. Chair, if I may just introduce the presentation. The presentation will be delivered by Gail Bursey, our Director of Healthy Public Policy at Toronto Public Health. So I'll turn it over to her.
Good morning. This is a presentation on the heat relief communication, specifically for the shoulder season and for the spring's shoulder season, which is May 1st to June 1st. In the presentation, I'll review the rationale behind this work, the targeted messages that we'll be sending out, as well as an overview of what we're going to be doing once the shoulder season ends. So at June 1st, we clearly have a lot of work to do over the course of the summer to deal with heat relief. By way of background, Municipal Licensing and Standards has a bylaw that requires all landlords to provide an indoor temperature in apartment buildings of 21 degrees Celsius. This temperature has to be provided from September 15th Hi, Mark, and here's my colleague who had a slight detainment this morning, but he's recovered. So it's September 15th that the municipal licensing and standards bylaw needs to be in place until June 1st of the following year. Some landlords interpret the bylaw as meaning that heat has to be on until June 1st and then is taken off. It really is that the indoor temperature needs to be 21 degrees. So this confusion, as you can imagine, causes a lot of apartments to be uncomfortable and tenants to call their tenant association of landlords and to call you. So to deal with this issue, in March of this past year, City Council requested that Municipal Licensing and Standards, MLS, the Medical Officer of Health, and Strategic Communications work together to continue to communicate, as we did in 2018 and got some positive feedback, but to continue to communicate to landlords, but to do it more frequently and with more clarity, this nuance within the bylaw. So I'm going to describe the communications, but when I say we, I'm really talking about MLS. They are the leads for this issue, but we were directed to work with them and Strategic Communications, but we had a lot of support from our own communications staff that you met earlier this morning on this work. So there were two objectives that we were focused on. One was for the landlord to understand the bylaw, but to also understand that they can use judgment. The reason they really need to use judgment going forward is we have a different climate pattern now. We have more frequent days, we expect to see more frequent hot days, but we also have an erratic change from day to day in temperature, which obviously makes it difficult for the dates that were put in the bylaw during a time we didn't have this kind of climate change occurring. And in fact, we have direction to work with MLS on looking at those dates. But for the time being, we do need to communicate to landlords this subtleness that they need to be appreciative of as we enter the shoulder season this year. The other communication is for tenants. There are things they can do to make their units not as hot. There are places they can go across the city that we provide on the city's website to cool off. The landlord is directed to post those cool sites or to have a cool room. So we need to keep dialing up that communication so that tenants know there are some options for them until we deal with the dates within the bylaw. This is a communication strategy as developed by the experts in Toronto Public Health Communication and Strategic Communications, and it follows a logical pattern. This first set of communications in May is the kickoff before we enter the summer season across June, July, and August. It's led by MLS, but strongly supported by those of us in public health who've been working with them on these issues, as well as Strategic Communications corporately. And the communications clearly launches with communication to landlords in an intensive way. So I go through in a minute the multitude of messages that we're going to be giving them, but it comes to them through the month of May, and then as the temperature is monitored, if it increases, we add communications to that messaging. So here we've listed all the forms of communication. I'm not going to go through them, but I wanted you to have an appreciation for the wide range of communication medias that we're using, as well as the detailed messaging that we're giving to landlords. So clearly, the communication is coming in a traditional letter. It's also coming electronically as an email. It's coming in a package that's sent to them that's got electronic material that they can use in further communications. It's coming through our Facebook and Twitter and Instagram. There are 360,000 followers through Twitter that the city has, so it's a really effective way to quickly reach a large number of people. It's on our website. And then new for 2019, we worked really hard with the industry. So you'll see there a list at the bottom of associations that work with apartment property owners and can magnify our message and give a trusted ear to the landlords if they have any doubt about the ability to turn off the heat or turn it down before June 1st and still be within the bylaw. And the other thing that's there is a trade publication advertisement. So we're trying to get the message out in untraditional ways to make sure that landlords are appreciative of the differences between the way they've traditionally interpreted the bylaw. Through some expertise from communications, we found it was important to add graphics this year. So this graphic with some text really clearly explains the thought processes that we need the landlords to go through. So it reads, "It's hot. Landlords can turn off heat on warm spring days. You need to maintain 21 degrees. However, if you can do that because the outdoor temperature is so high that you don't need the heat on, you can turn it down or off. Use your judgment." And because, and this is from communications, you apparently need to tell people things 7 times before you have behavior change. So, and you need to do it in ways that are more and more compact. So this is the same message, but just with one really straight, almost blunt message. It says, if the building temperature is 21 degrees without heat, you can turn off the heat. So those are all the materials that we're sending out to landlords. Looking at tenants is a similar kind of list that's both print, hard copy, electronic, social media. And at the bottom there, also multilingual through 311 contact information. But then at the bottom, we've listed tenants associations that we're working with to magnify the messaging so that tenants can be communicating with landlords, and together they can make a determination about what needs to change within the building based on how things are occurring overnight in the weather patterns that they're dealing with. You can also see on the right-hand side there an example of a social media post. So we're really, within the city, communications is using social media more and more as a mechanism to get messages out, and it's obviously quick, and it tends to be quite targeted, so it gives you a sense of what the messaging will look like through social media. And then, as I mentioned earlier, the pattern is to communicate all this information through the month of May, and then to monitor the weather with Environment Canada ourselves and MLS. And as we see a need, we would increase the communication, again through social media, 311 messaging, and using a city spokesperson who would speak to the issue on a citywide basis. So I wanted to give you a sense of the next steps and what to expect as councillors and Board of Health members as well. We will send out these Heat 101 packages to the building owners and their delegates. We'll provide councillors with similar information, but as requested, we're also giving you some material that you can cut and paste and drop right into newsletters, some social media content that you can use immediately. Materials will also go to community partners, and we'll begin our media posts. And finally, we'll be monitoring the weather to decide when to trigger additional responses. So everything I've spoken about takes us to June 1st. So the shoulder season ends. And as I said, we'll be looking with MLS at the bylaw and the dates for appropriateness moving forward, given the change in climate. The work I listed here, I wanted to mention because you directed us to go and meet with all of the city departments, or divisions rather, that are involved in heat relief as part of their operations, and get them to dial up their work. And also to work with those departments, or rather divisions, strategically to increase the city's strategic response to extreme weather, because we're going to need it ongoing. So the work that's gone on that'll start this summer, that increases on work done previously, starts with our proudest moment, expanding the heat relief network. So you may recall when you asked us to build on work we reported that other cities had done where they used a heat relief network, which is all the open to the public cool spaces, all the air-conditioned spaces in the city. But you wanted us to expand them beyond the city to nonprofit organizations and private sector. So we were able to do that by bringing in Cadillac Fairview, who run the Eaton Centre, Fairview Mall, Sherway Gardens, and RioCan, who have Young and Eglinton Centre, among other malls who are now included in the heat relief network. So they're listed on a city website, and they're there for residents and people who work with residents to direct them to cool space. We've also added nonprofits such as the YMCA and many more city facilities. So we've moved from 180 cool spaces to 270 for the first time this year for summer 2019. We put that, as I said, on a searchable website, one that was an improvement over last year's, because last year we were doing a pilot to see how this network would work in Toronto. It's been well developed in other cities that deal with heat relief, but we wanted a bit of a made-in-Toronto solution. And we got some good feedback about it, so we've now increased the power of the searchability on that website. We're also running a neighbor checking pilot, because that as well has been proven to be an effective way to manage heat relief. When neighbors know who you are and know what your risks are, having them checking regularly is quite effective. And as I said, we're providing resources to landlords. Staff training, so any staff that in Toronto Public Health and parts of the city already see people who need relief from the heat, they're getting an online training so they understand this shift with climate change where they need to be more vigilant in reminding residents, and so that they know there are now more sites that people can go to, so there may be some that are even closer to their home than there was previously. Bylaw updates. So MLS and ourselves spent a lot of time together on bylaw, and we will continue to do that as directed by you. There's a list there, rest assured, of all the things you've asked us to look at in the bylaw work that we do with them related to this issue. Sorry, and I didn't mention shade structures, which is another long-term solution. So there are 3 redevelopments of apartment towers in the city that, with planning, have been convinced to add a shade structure to their space. They wouldn't previously have done that, but they're starting to understand it's part of their responsibility as landlords. If they're already doing redevelopment, it's efficient to add that at the time that they're doing that work. So there's 3 more of those going up in the city this summer. And then education resources is an example of, again, looking at any of the city's existing processes that can be dialed up. So there's a support service, for example, through the library that reaches individuals who are homebound. So we've piggybacked on that messaging to make sure those individuals are aware of what they need to do for heat and where they can get relief from it. So I'd be remiss if I didn't say thank you very much to communications, both Toronto Public Health and Strategic Communications and MLS for the work to get us strengthened up for this May spring shoulder season. And for the work across the city, it really is folks like Parks and Rec, shelter support and housing, long-term care, libraries, all of whom have been really good to increase their operations and to think with us strategically about how to bring a really strong response to heat relief this summer and to continue to build on that for subsequent summers. So that's the end of the presentation. Thank you.
Thank you. And I would note we also have Mark Scraga here, who now wears a uniform every day, I notice, from Municipal Licensing and Standards, who can answer questions. You look sharp. We'll begin with questions. I saw Councillor Perks and then Councillor Lai.
Yeah, thanks very much, Mr. Chair. Mark, so where are we with the bylaw?
Well, that's part of the work that was ongoing. One of the directions we had was to strike a working group with various divisions and agencies looking at this, and we'll be reporting back in the fall of this year on recommendations with respect to bylaw amendments. We did make a subtle change to the heat bylaw last year to have a bit more clarity that landlords don't have to have the heat on and off, so that was done last year, but there's that bigger volume of work we're doing looking at all the other possible bylaw solutions to address this issue.
So fall this year?
End of Q4 2019 is what we
Well, that's
committed
not
to.
fall.
Sorry, my
That's
mistake.
okay.
Yes,
You'll
by the
lose
end
a
of
quarter
this
of it.
year, we will have the report back to, for committee to consider.
And I'm not sure who this is for. So I've had an experience we worked on together recently where there was a building where the electrical was going to go down, and the landlord, it was 1,500 people, and the landlord had absolutely no idea who the vulnerable tenants were. I'm wondering what work we do as a city to provide information, supports, whatever it is, to large landlords so that they know how to identify and provide supports to the vulnerable individuals.
Yeah. So I can speak to that, and actually I'll be better. We will be bringing a report in April to committee on that very issue, because that was related to another direction from council for us to look at. So we are bringing actually in April a report on that matter. So
Stay tuned.
I'm not 100% clear which committee we're reporting to because of the new committee structure. It won't be the licensing committee. I think it'll be going to the housing, planning and housing committee.
Councillor Lai.
Through the chair, I just wanted to know whether this include condominium buildings?
Our bylaw applies to all rental properties. So if there's rental units within a condominium, it would apply. But if it's an owner-occupied condominium unit, no, it does not. Just like we do not prescribe minimum heat temperatures for a person's residential own house. So a condominium only, our bylaws speak to when it's a rental property only, because that's out of the hands of the occupant at time when it's a rental property. Whereas if you own and operate your own unit, you have full control over the heating levels.
Because, through the chair again, because I own a condominium unit and I am a landlord. I rent it to a tenant. So most of the buildings, they have rental units in the building. And I'm just wondering, and I just wanted to make sure that you cover your communication strategy with condominium corporations, because at the last meeting, I said I live in a condominium unit, and I really feel very hot. And I think perhaps you should consider your communication strategy with the condominium corporation as well.
We'll take that into consideration. Thank you. Yeah.
Thank you.
Thank you, Councillor. Peter.
Thank you for your presentation. I just want to clarify, why actually is this an issue? Heat relief is very important, but in this shoulder season, I would have thought that owners of condominiums would actually jump at the chance to turn off the heat to keep in compliance, because it would certainly cost them less, or am I misunderstanding this?
So, through the chair to Peter Wong, it's not so easy for a large residential apartment building for them to turn off their heating units, their boilers and that. So it's a challenge sometimes for those buildings, some of the older buildings, or even the larger buildings, this building, for instance, when we get into the warm spring days in May, that they can't just turn the heat on or off. So that's the challenge for them. I believe, yes, they would, if they could do it simply, they would, because it is an energy savings, but it's not that simple for them in some of these more complex systems or more antiquated systems.
Thank you for explaining that.
Councillor McKelvey.
Thank you, Mr. Chair. When was this bylaw written with the 21-degree minimum? Is it old in the dates?
Through the chair, the councillor, it predates my time. Yes, it's been around. I'm looking at the bylaw in front of me, and there's a reference to 2006. But the heating bylaw, and most municipalities do have a bylaw of this nature. It's a question of, it used to be traditional, prescribe a minimum heat within a specific date range. Some municipalities actually are removing the date range and just having a minimum heat. So that's part of the work we're doing to look at what's the most effective way of doing this. At the end of the day, part of the confusion of the bylaw is people just think that they have to have their heating systems on within the prescribed dates. Right. And it's really not that. When we go in to deal with a low heat or no heat complaint, we're actually measuring the temperatures. That's where we identify a violation, not that the system is on or off, because it could be on and still not delivering enough heat. So we're looking at how we avoid confusion. But in terms of this bylaw, yes, it's been around for several decades for sure.
So are there studies underway to look at how climate has changed since 2006, when might be a better window, and also can we update it with a maximum temperature?
So the maximum temperature issue is part of what we were directed by committee to look at and report back at the end of this year. That is a challenge, and it's been one that we've discussed, and last year, executive, I brought forward a report on that very issue. It's not, as simple as mandating a maximum temperature, because that means mandating air conditioning in all apartment buildings. We have thousands of apartment buildings. Some have air conditioning in them. Most don't, though. And of course, there's a lot of issues that go with that. And part and parcel would be, does the electrical system within the building, is it capable of supporting such a low demand? Is the hydro distribution system delivering power to that building able to handle that low demand? And then there's a cost factor of if it gets imposed and passed on to tenants and then that affecting affordability, how do we manage that issue? So it's a very complex issue, and it's not one that we can simply answer. But we are looking at that with this working group to find.
And how have you been interfacing with the resiliency study that's underway in the city right now? Like, have you been providing input? Are you working together so that you're also giving recommendations to them on what should be done on rollout? So moving towards smart meters and things like that. Like, are you providing those sorts of recommendations? Because that will help strengthen their report.
Mark saying I can jump in because this isn't a technical question, although we've learned a lot about MLS's life and his work. So that's why you see us both here, because there's an overlap between climate change and MLS and health. But this is an issue, and we are monitoring climate change, you're correct. It's very difficult to monitor with accuracy, and that's why this is just one example of a policy that needs to be adjusted. So the dates need to probably come out and some way worked out with landlords to still have the intent of the bylaw. But for sure, resiliency is involved in both the executive level working group and the one that's more boots on the ground management level work group. So they've been there from the beginning of the work that we've been doing recently on this. And we will be coming back with a report to the Board of Health in the fall about the experience this summer, not really as a health issue, but as a issue that starts as health and climate change, but finishes as a both strategic and operational issue for the city for any extreme weather event. And we'll be proposing to you a long-term home for this work within the city that still has participation from MLS and health and libraries and whoever, but someone actually needs to oversee it as an extreme weather response issue any time of the year that the city needs to deal with strategically and then operationally. So you're exactly right. It isn't as simple as either one of these groups. It's bigger than that. But this is the example that's played out, a bit of a case study that we'll bring back and tell you about in the fall, and then propose a long-term home for this work.
Thank you.
Thank you, Councillor. Other questions? Kate.
Thank you, Chair, and thank you for the presentation. I'm wondering just if you could point those of us who are new on this committee to some of the background reports that have gone into this. So it's well appreciated as a presentation, but I think some of the questions are arising out of a sense of what the context is and where this is heading. Are there reports on each of the initiatives in the broader heat relief response?
I could start if you want. So there are reports from both, and we can put together a package for you that tells the story. There are several from both sides. On each individual item on the screen, there wouldn't be an individual report, but they would have been mentioned in previous reports where we proposed a more across the city strategic approach. Last November report did that, and also in the spring of last year. So there definitely are reports that relate to the issues there. They're often looking at best practices or progressive approaches in cities where they're dealing with climate change very actively, so we can provide that to you. And then in some cases, it's a made-in-Toronto solution. So for example, neighbor checking was piloted previously, and Councillor Perks has flagged it to us, and had some success. It does need ongoing attention, but as an issue in other heat events, national or internationally, it was extremely effective as a way to prevent illness and death. So we can provide reports on all of those.
Any other questions? All right, we're going to move into speakers. To speak? I'll say a few words. So we had a fulsome report last month as the board on heat relief, and this is one that both through licensing, through planning and housing, and through the Board of Health is going to continue to be an ongoing point of study and change this term. I think to put it in context, there are 3,400 apartment buildings that do not have air conditioning in the city. And with rising temperatures and with climate change and more extreme inclement weather is increasingly, especially in the shoulder seasons, we're seeing temperatures jump up to over 30 degrees for a couple days and then drop down to 10 degrees. Meanwhile, we have apartment buildings that don't have AC and have old boilers. And so the solution to this is multifaceted. You know, in the short term, cooling rooms, utilizing spaces and for cooling spaces, the list of vulnerable tenants and the outreach, changes to window safety in the municipal code, and a proactive communications approach. And last month we directed and asked staff to come back with a communications approach, which is here, and I want to thank staff for that. I think it is far and above what we've done in the past, and I'm looking forward to seeing in the fall what the results were. But of course, in the medium term and long term, including AC in all new developments, how do we make that happen? And how do we do tower renewal in the medium term, but do it in a way where we don't put at risk the housing for people who have affordability challenges? If suddenly everybody can say an above guideline rent increase in order to bring in ACs, you're going to dehouse people. And so you need to make sure that on the medium term, we are supporting tower renewal without dehousing people. And so it's a complex issue. It runs across departments. We said as a board and as council, we wanted to strengthen and beef up our proactive communications approach. I think we're doing that, and I want to thank staff very much for that. But as the questions have indicated here, does the bylaw need to change? Should we look at a maximum temperature? All of these is going to be part of the ongoing series of reports going forward. But on this, I want to thank staff. And I don't believe there was a recommendation on this, so there's nothing to move. And so with that, I'll close my remarks, and thank you very much. Oh, I'm told we do need to move a receipt. Moved by Councillor Wong Tam. All those in favor? Opposed, if any? Carried. Moving forward to our next item. Item 4.2, Ontario Government proposed changes to the provincial healthcare system. By way of background, this was a City Council member's motion that was brought forward because since our last meeting of the board, the province announced rather comprehensive changes associated with a range of health agencies. So we have a report in front of us. Are there anybody from the public who wishes to speak to this item? Seeing none, questions of staff? Sue Wong.
Context of this board, that Bill 74, just for context, wearing my previous hat, is going to revolutionize delivery of health care to this province. One term, this government, or future terms of this government, will have significant impact in terms of access and as well as the whole concern of communication. Because when I read this report, Mr. Chair, I was extremely concerned that this board is only receiving this report for information. When I was at Queen's Park, any report for receive for information, meaning this board is accepting what Bill 74 is doing. Today and tomorrow, Bill 74 is going through clause by clause, meaning that this bill is almost passed by this government. So think of what we just approved this morning about the overdose, the opioid crisis that we have. And I am concerned because this board has consistently, from the time I was on this board back in the 90s, have been championing for the most vulnerable.
Sue, we're just in the point of questions of staff. And so are there questions for staff? Because we'll have a moment for speeches.
I think that we need to ask staff how this motion come to be. Okay, that's the first question.
Okay.
Because I want some rationale, because this would never been a report from previous medical officer of health.
So through the chair, the request that came forward was in respect of providing a summary of the bill and its implications with respect to our operations. And that's in fact what the report articulates. It's a summary, a high-level summary of that which has been proposed under Bill 74, with some indication as to what that means in respect of public health. So as we understand it, Bill 74 does propose some significant changes to the healthcare system. No question, you're absolutely right about that. However, when it comes to public health, what is clear through Bill 74 is that public health really isn't mentioned in the context of that bill, save and exclude for some reference with respect to our relationship with the local health integration network. And other than that, what we have heard, not articulated through Bill 74 in its language, but what we've heard through provincial counterparts, is that the method by which public health will be accounted for in the proposals of the new health system or the changes to the health system is separate from that which is described in Bill 74.
Okay. Thank you. Councillor Perks.
Towards the end of the report, actually the last paragraph, you mentioned what's likely the more concerning thing, which is what's going to happen Thursday when the provincial budget comes out. In past provincial budget years, the city's assembled a team to review that budget. I assume public health is going to be part of that team?
So through the chair, we are engaged with the city manager's office. Representation from the city in respect of the budget lockup does come from the city manager's office. They're aware of our interest. We will be monitoring the budget and providing our perspectives from a public health point of view to the entire city's summary and assessment of the budget and its implications for us as a city.
Thank you.
Thank you, Councillor Perks. Other questions? I have a couple. So we're still learning to the medical officer of health, some of the changes associated with this new centralized agency. So for my background, so it is proposing this new centralized Ontario Health Agency to consolidate 8 existing health-related services and programs. Is that right?
I believe it's 6 agencies that are included.
6 agencies. Will it also include the LHINs?
So I think there are a number, the LHINs will be absorbed as part of that. What the manifestation will be, I think has yet to be fully articulated.
So I guess a question I have and I would be asking the province, but they're not here, so and I will be asking you, is I thought the move within healthcare was to further decentralize and embed healthcare within communities. And so what health rationale from the delivery of services is there for further consolidation, especially as it relates to the existing 14 LHINs?
So again, it's difficult for me to speak on behalf of the province. What I can advise the board of is that which I've read through the documents that have recently been released by the province regarding the Ontario health teams. So what we do know is that you're quite right, Mr. Chair, there is a large, what has been referred to in the media as a super agency called Ontario Health, that is subsuming a number of existing smaller provincial agencies that are active in the health system. And the LHINs appear to be included in that. Whether there will be a subsequent iteration, I think, has yet to be fully articulated by our provincial counterparts. What has been made clear by the province is that over and above the creation of this large super agency, Ontario Health, there will be created Ontario health teams, that these health teams will be voluntary in nature, and the expectation is that different health providers in different communities will elect to work together to provide services to particular populations. I think in the first instance, having looked at the documents that were just released by the province in the middle of this past week, it sounds like the first instance of these teams will be largely geographically based. So there will be a number of healthcare providers, hospitals, long-term cares, community care providers, individual clinical providers, including family doctors, family health teams, and the like, plus community service agencies who will be allowed to work together to service those populations.
So from cancer care to Health Quality Ontario to eHealth to the LHINs, within the affected organizations, as a result of this provincial change looming, do we receive support or funding for programs from any of those effective organizations as Toronto Public Health?
So we receive provincial funding, absolutely, but we are not tied to any of those agencies in respect of funding. But we do receive provincial funding. Just by way of reminder to members of the board, the vast majority of our funding at Toronto Public Health is cost-shared funding, 75% provincially funded, 25% funded by the city.
But through the 14 LHINs proposed to change, we receive specific programmatic funding, do we not?
Very small funding, and I might refer to Jan. We have one particular program that I can think of, the details of which I think Jan has in front of her.
Yeah, so we have for the methadone program, a case manager with some harm reduction supplies. It's approximately $113,000, and we have had funding for, in this year again, Indigenous cultural sensitivity training. It says in the report approximately $20,000. It may be about $15,000 right now, but that's not an annual cost, but the 113 is something that we have received on a regular basis.
Okay, thank you very much. Those are all my questions. We'll move into speakers to speak. Sue Wong.
With a bill of this magnitude, we as a board need to be more proactive and speaking out, and much more for the chair and as well as the medical officer of health to address this issue. This is too late in the game when this bill, as we speak, is before the committee clause by clause, today and tomorrow. So there's no opportunity to amend, to bring in new motions, new clauses to the bill. And if we believe those vulnerable residents that we are trying to serve, those crises that we see in every board meeting that the chair just talked about earlier, those residents that are counting on this board for us to speak out. So accepting and receiving Bill 74 the way it is a concern for me on this new board. But more importantly, if you read the op-ed piece almost daily from the former the Deputy Minister, Dr. Bob Bell. So if you read his article, it clearly tells you this super agency will not be able to implement in the 3.5 years to this term of this government. So my question to you, Mr. Chair, is that this board for future legislation provincially, we need to be more proactive on the game like you're doing for the upcoming budget, this Thursday's budget, because we cannot be silent. We cannot be sitting as an observer or a bystander, because when we go out and saying receive this report for information, we are saying that the chair and the medical officer of health on behalf of this board saying nothing. I don't believe we're doing nothing, because at the end of the day, the implementation is the most challenging and those are the most vulnerable that count on this board to speak out. So I appreciate the motion, Mr. Chair, that you're putting forth for this particular motion, but I think we need to monitor, we need to ask staff to make sure making sure those who are needing services, because the LHIN is gone. So those 5 LHINs that are affecting the city of Toronto, where do they go? What telephone number would they be calling to get access to services, okay? Because those seniors that dealing with the heat we just talked about right now, who are they gonna call to get help? If not 311, they can't get access. If they can't get the care coordinator trying to get their services. So at the end of the day, when we have provincial or federal legislation is gonna affect the residents and the people of the city of Toronto, we should be speaking early, not just to receive this report like we're doing today. That's it.
Thank you, Sue. Any other speakers? I'll say a few words. I have a motion, if it can be placed on the screen, that was advance circulated. First is to forward the report to the Community and Economic Development Committee and to call on the province to continue funding for all programs currently receiving provincial funding at Toronto Public Health, including funding received from local integration networks, which are affected. I think it's fair to say that the moves that we're seeing from the province are deeply concerning, that whether it's on overdose prevention or the creation of a new super agency or the budget, which will be released this week, and indications could be that it's going to be another moment, that the province seems to be pursuing cost savings at the expense of enhanced health delivery. And so the motion in front of us, specifically related to the new super agencies, to ensure and request that at bare minimum there will not be a loss in service. I think, I'll speak in part in response to directly to your comments as they were related to me and the medical officer of health, is that, as seems to be the case with this provincial government, the announcement of a provincial agency was done on February the 26th. Since this meeting, the board met last, with no notice, no consultation, no warning, and still after the announcement, no details. This was the very first time the board has had the opportunity to meet. And so if there has been the failure in leadership, with all due respect, Sue, it is not on the part of the medical officer of health or myself as the chair. It is the provincial government for their absolute failure in leadership on health. As it relates specifically to the path ahead, and Councillor Perks in his questions, I think rightly suggested that there is a budget coming up on Thursday. And if any indication has been given for public health units and programs right across this province, we need to be prepared to react quickly in the service of the residents and citizens of our city. And for that reason, as you will all be aware, we have called a special meeting of this board, something that is not often done, for the 15th of April. It should be in all of your calendars at this time, and directly to deal with the budget. And so whatever the outcome of that budget is, with no timing and no notice and no consultation, we will not only react, but we will seek to respond proactively. And with that, I'll move my motion. Oh, Councillor Perks to speak. Question of the mover.
Feeling nitpicky.
Sure.
Could you put in to continue full funding?
Yes, as a friendly amendment, if we could continue, call on the provincial government to continue full funding, as that was the intent, and Teacher Perks caught the error. Thank you. Any other questions of the mover? All right, seeing none. Anybody else to speak? Seeing none on the motion. All those in favor? Any opposed? Carried. All right. Moving forward, we've now come to a topic that has no controversy or debate or in these days. Item 4.3, addressing vaccine hesitancy. We do have a series of deputants, but we have a presentation. So I'm going to propose that we take the presentation first. We'll then hear from the deputants, and then we will go back to questions of staff. To set the context, I will turn it over to you, Eileen.
Thank you, Mr. Chair. So just coming up to the presenter's desk is my colleague, Dr. Vanita Dubé, one of our Associate Medical Officers of Health at Toronto Public Health. She'll be providing the presentation entitled Addressing Vaccine Hesitancy. With that, I'll turn it over to you, Vanita. Thank you.
Thank you, Dr. Davila, Chair, and members of the board. So I will be speaking to you today on addressing vaccine hesitancy. First, let's talk about what is vaccine hesitancy. It's a relatively new term defined by the World Health Organization as the reluctance or refusal to vaccinate despite the availability of vaccines. The World Health Organization this year identified vaccine hesitancy as one of a top 10 threats to global health. In Canada, about 20% of Canadian parents are considered vaccine hesitant, and it's mostly because they're unsure about the safety and effectiveness of vaccines. So what causes vaccine hesitancy? It's pretty complicated and it's multifactorial. The World Health Organization has defined a 3C model: confidence, convenience, and complacency. So confidence is essentially people have a lack of confidence in vaccines, in their safety, and how well they work. A survey of Canadian parents has shown that about 70% of parents are concerned about the side effects in vaccines, and 38% believe that the vaccines cause the disease that they're trying to prevent. Convenience is actually inconvenience in assessing vaccines, and complacency refers to perceived risks. The perceived risks of getting the disease are low by parents, and the vaccination is thought not to be necessary. Toronto Public Health does a number of things to promote vaccinations. We work with the public. We explain what vaccinations are needed by children and by adults, especially according to Ontario's publicly funded schedule. We provide vaccines in community settings, including to those who do not have health coverage. We answer questions about vaccines from the public and from healthcare providers. We also work closely with schools and childcare centers. We're actually providing vaccines in schools in grade 7 and 8, the human papillomavirus vaccine, hepatitis B virus vaccine, and a meningococcal disease virus vaccine. We also assess immunization records of students and children attending childcare centers and schools to ensure that they have high coverage rates. Finally, we work closely with healthcare providers. We provide education and support so they're ready to answer questions from parents, and we ensure that they have publicly funded vaccines available, including monitoring their fridges to make sure the vaccines are kept safely. Toronto's vaccination rates were in the news last week. The Toronto Star recently reported a rate that Toronto Public Health provided on MMR vaccination rates for 7-year-olds in the 2017-18 school year of 76%, which is not at our national target of 90 to 94%. There are a number of reasons why this rate is lower in 7-year-olds, and includes delays in parental notification of when they received the vaccines. There is no automatic system when a child gets a vaccine to notify public health, and so there's often a delay in when a child receives the vaccine to when public health is notified about it. We also know in Toronto that there are many newcomers who come here, and many of them come either without records or with vaccines that are not in accordance with the Immunization School Pupils Act, and so we must catch them up to make sure that their vaccines are up to date, and that can take time. As well, we do receive translated records, and we translate records for free, and that can often delay why a 7-year-old may not be up to date. We know, though, that in a year or 2 years from now, the coverage rates actually improve quite a bit. And so the 8-year-olds are, 88% of them are up to date with all of the required vaccinations, not just measles, mumps, rubella. And the 9-year-olds, 90% are up to date. And so through our assessment program process, we actually get the coverage rates up quite a bit. As well, looking at the full cohort of students who are in school, the 7 to 17-year-olds, the MMR coverage rate there is 89%. And finally, a number that we look at closely is our philosophical and religious exemption rate. And these are parents who choose not to vaccinate their children for philosophical or religious reasons. And the rate currently in Toronto is 1.7%. So how do we address vaccine hesitancy and improve vaccination rates in the city? Well, there's no one strategy that has been proven effective. We will need multiple strategies to counter the underlying beliefs that lead to vaccine hesitancy and increase vaccine uptake and acceptance. So this includes responding to misinformation. Misinformation is readily available on the internet and through social media platforms. We provide clear and truthful messages supporting vaccines to the public, to parents, to providers. And we also enable healthcare providers to address their parental concerns about vaccine hesitancy. This is a really important strategy because the research has shown that when parents go to their healthcare provider, that is a trusted relationship, and that is a relationship that is often successful at changing a parent's mind to make a parent choose vaccination. Other ways to address vaccine hesitancy and improve vaccination rates include hoping for and advocating for a province-wide real-time electronic vaccine registry that contains reports of vaccines administered by doctors at the time of vaccination and are reported directly to Toronto Public Health or to public health units. There is legislation that's currently on hold right now. As of July 2018, doctors and nurses were mandated to report vaccines directly to public health. That legislation was put on pause, as currently there is no good electronic means for reporting those vaccinations, but certainly that's something that we need and that will take the burden off parents. We also continue to work with parents, schools, and healthcare providers. This is really important because we actually want to aim to receive the National Public Health Agency of Canada target levels for vaccinations between 90 to 95%. And so this includes encouraging parents to vaccinate their children, supporting schools as they implement the Immunization School Pupils Act, which includes suspending students from school if their immunizations are not up to date or if the students do not have a valid exemption. And again, supporting healthcare providers to know how to appropriately respond to vaccine hesitant parents. So what more can be done? There are a number of recommendations that are in the report that we are asking that the Board of Health consider. It includes asking Health Canada to explore ways to restrict misleading and false information about vaccines. We also want to work with healthcare professional associations, doctors, nurses, chiropractors, pharmacists, naturopaths, the bulk of them, to make sure that all of the health professionals communicate that vaccines are safe, communicate confidence in vaccines, and encourage their patients to vaccinate. We also want to ask the World Health Organization to address vaccine hesitancy. And this particularly is in looking at what the WHO has done on tobacco. They have a framework convention on tobacco, which has been extremely successful at providing guidelines and recommendations to countries to address tobacco, including things like restricting advertising and sponsorship of tobacco products and by tobacco companies. And because vaccine hesitancy is such a global problem, and we're asking you to consider that the World Health Organization consider this further and address vaccine hesitancy more systematically. And finally, Toronto Public Health will work to develop a comprehensive, multi-pronged strategy to address vaccine hesitancy that will include supporting local healthcare providers and measures to mitigate the negative impact of false advertising. And that's the end of my presentation. I'm happy to take questions.
Thank you. Because we have members of the public here, we're going to let them speak first, and then we'll have you and the medical officer of health afterwards for questions.
Thank you.
Thank you. So we have a series of speakers on this. Our first speaker is Rosemary Fry. Is Rosemary here? Rosemary, if you take a seat, you'll have 5 minutes, and there's a clock on my right that you'll be able to see your left. And you can begin when you're ready. You can begin when you're ready.
I'll give you the thumbs up for the sign. Thanks. Okay. Oh, the things over here. Hi. Thanks for letting members of the public speak. My name is Rosemary Frey. I know a few of you here. I have an MSc in molecular biology from the Faculty of Medicine at the University of Calgary, and I was a medical writer and journalist for 22 years. But I quit 3 years ago because I just got tired of being lied to every time I picked up the phone to talk to a medical researcher or physician about their work, their clinical guidelines. They'd always be, everything they were talking to me about was being skewed because of the pernicious influence of the pharmaceutical industry. They're all compromised. So I ran away, I pivoted to activism and journalism on social justice and economic issues. But I've been dragged back into the medical arena because of the hysteria that's been created about measles and anti-vaxxers. Anyone who has at all questions the safety or efficacy of vaccines is labeled as spreading false claims and misinformation. The population has been fooled into thinking that the corrupting influence of pharma stops at the door of vaccines, and instead that people speaking out about problems with vaccines are the villains. Well, with my background, I'm pretty good at figuring out what's misinformation and what's not. And I've discovered there's a ton of evidence that vaccines cannot be considered to be universally safe and effective. Just one quick example, the neurotoxicity of aluminum in injectable vaccines hyperactivates the immune system in fetuses and also in the first few years of life. That in turn results in brain and immune system injuries and also autoimmune diseases. This is well documented. And yet, the recommendations you have in front of you today compare people like me who question the safety and efficacy of vaccines to big tobacco and to seek to silence us and to place the authority to do this in the hands of the World Health Organization. Have you forgotten that just 10 years ago, the World Health Organization was complicit in the wasting of billions of dollars by governments that stockpiled the ineffective Tamiflu vaccine? That decision was based on misinformation from the WHO. And this information was written by people who were paid by the distributors of Tamiflu. It's well documented, including in this book, Medicines and Organized Crime, How Big Pharma Corrupted Healthcare by Dr. Peter Gutsch, who may have heard of the Cochrane collaboration, which is one of the fairly well-regarded evidence-based databases and analyses on medicine. And I've also seen, there's other pillars to this. So there's the World Health Organization is complicit in not telling the truth and actually with drug companies. I've also seen firsthand how the media, unfortunately, are also complicit. It's kind of shocking. I went to an editor that I've written for recently and I said, look, I'd like to write an article about how there's lots of information about vaccines and how they're great, but why is no information allowed by public health or by the media talking about adverse events, just like any other area of medicine? There's like salmonella was in the paper the other day talking about how many are hospitalized. You don't hear about the real adverse events. And he said, well, you know, vaccines are safe and effective. And I think, is this working? Yes. And he said, actually, and also, pharma companies don't make any money off vaccines. So you know, what's the big deal? And that was a very odd statement. I looked at his background, and in fact, he has had in dealings with pharma companies in a previous organization he dealt with. And also, he's a very smart, well-read person. If you take 2 seconds, you can find lots of information about the fact that vaccines are huge money makers for pharma. They're the top sellers for many of them. It took me 2 seconds to find this Financial Times article documenting operating margins of 25% to 30% for vaccine manufacturers and billions in profits for the big 4 vaccine makers, Pfizer, GlaxoSmithKline, Merck, and Sanofi. And check the lobbyist registry records for the province and the feds, and you'll see they're full court press to get these vaccines through. We pay for them. And we also pay for the public health for these education sessions. And if this is, tell me whether this is really truthful information coming from public health. This is the information from the session in the video. Aluminum, mercury, and formaldehyde and other additives in vaccines and they make the vaccines safe by keeping the vaccines pure and stable before they're given to people. Aluminum salts are added as an adjuvant to strengthen the effectiveness of the vaccine. Adjuvants help stimulate the body's response to the vaccine, which results in getting faster, stronger, and longer-lasting immunity to a disease. With the information, where it's talking about adverse events, it's all pure. You can tell this is largely influenced by pharma. I've seen it before in my career for dozens of years. So if you allow these regulations
you're
to be
just
passed,
coming up on 5 minutes. I'm going to ask you to wrap up in a sentence.
I will. Thank you. Thanks, Joe. If you're complicit And if you allow these draconian recommendations, that you're going to be silencing and censoring people and organizations who are truly trying to educate the population to the real and present dangers of vaccines, you're complicit.
Just going to ask you to wrap up. You're over 5 minutes.
And you're good people, and you do a lot of good things for the city, but if you just follow orders and agree with these
Sorry, you're
recommendations,
over 5 minutes.
you're
Thank you.
doing
That's
more
your
harm
time.
than good.
Thank you. Any questions? Thank you very much. Seeing none, next up we have is Safia Ibrahim. Is Safia here? Hi. If you want to
stay here or?
if you want to come to the table, please. Thank you. Just so we can all see you. Thank you so much.
You're welcome.
And you'll have 5 minutes, and there's a clock just on my right on your left.
Okay. Okay, so as Vanita stated, it was reported last week that only 76% of 7-year-olds in Toronto were immunized against measles in 2017-2018 school year, while I, on the other hand, do not think twice about vaccinating my own. I circled my calendar with a big red marker and waited anxiously for the wellness checkup. I was proud to hold and console my children for each one of the immunizations, while letting out a sigh of relief, knowing that my children were protected from the disease that took so much from me. We as parents spend so much time and energy on protecting our children. We make sure they are secure in their car seats, and when traveling in a vehicle, we dress them in snowsuits, hats, gloves in the winter, and we use sunscreen in the summer months. Why a parent would take a risk by refusing to vaccinate when we are aware of the ramifications that measles, mumps, rubella, and polio, and all the other diseases that immunization protect against is mind-boggling, especially to someone myself. We are fortunate that polio was eradicated decades ago in Canada due to the polio vaccine. We have forgotten how it could cripple someone not only physically, but emotionally, socially, and even financially if they are lucky enough to survive. As a polio survivor, I hope to give you an insight on how the virus has limited myself. I contracted the polio virus in Somalia at the tender age of 1, as I was starting to take my first steps. A relative of mine went out to the store one day for a treat and came back with the polio virus. It was then easily passed on to me as we played together that same afternoon. It started with a fever like the flu and left me with paralysis and weakness of both of my legs within days. I have spent the following 6 years of my life crawling. I watched from the sidelines as my peers learned to run, play hopscotch, soccer, and eventually start school. A rite of passage that didn't apply to me in Somalia. A crippled child had no business being in school, and it still is the case today in some countries. At the age of 8, I was lucky enough to immigrate to Canada. I remember meeting Dr. Wedge at Sick Kids Hospital for the first time. He was sympathetic and told me that I was the youngest polio patient he has seen in Canada as a pediatrics orthopedic surgeon. I was fitted for my first pair of bilateral KAFOs, which is braces, and given 2 crutches to keep me balanced. To me, it felt like a life sentence because I just wanted to run like the other children. I continued to sit on the sidelines as my newfound friends went to Nathan Phillips Square to ice skate, Blue Mountain to ski, play baseball, and enjoy all the activities I longed to try without any accommodations. Due to the leg weakness polio has left behind, I fall constantly. I used to fall as a child. I fell at the Eaton Center while attending a move with my friends as a teenager, and I have fallen in front of my colleagues at work, while pregnant also with my children and at their school as well. Can you imagine the embarrassment an adult would experience after falling at their child's school in front of teachers, parents, and other children? It happened to me numerous times. Now, as an adult, polio came back with a vengeance. which at this point is called post-polio syndrome. I had my first hip replacement at 35, just 2 years ago, because of hip dysplasia caused by polio. And I have arthritis on both of my elbows from prolonged crutches use, and this is just the tip of the iceberg, as I am 27 and I still have the rest of my life to live. I still sit on the sidelines these days as I watch my children ride their bikes or roller skate at the park, but with a smile and a sense of pride, knowing that I have protected them by choosing to vaccinate them. Babies and children cannot speak for themselves. They rely on us adults and parents and caregivers to make the best decisions for them. Not only is vaccinating responsible, it has been proven time and time again that vaccines work. Living with polio has been difficult, but what's comforting is the knowledge that it is preventable with immunizations. So please protect your children and vaccinate them. Thank you.
Thank you, Safia. Questions for Safia? Sue, yes. Thank you, Sue. Oh, Safia, if you want to just stay for a moment, there may be other questions. Dr. Wong.
Thank you for sharing your story. My question, and this is a significant real life story. In your opinion, why do you think that parents are vaccine hesitant and not willing to vaccinate their children?
I believe that we have forgotten the ramifications and the effects of these diseases because mainly due to the vaccinations and knowledge and education that we have learned throughout the years. If you go back to the 1950s, there was a lot of people with polio, and there's a lot of people here that haven't experienced that or haven't come across with someone with those kind of conditions. And I think that's what it is. If you don't see it, then it's out of sight, out of mind. It's hard to believe, yeah.
Thank you.
Thank you. Any other questions for Safia? Seeing none, thank you very much. Our next speaker is Janet McNeil.
Just going to take me a sec to get all my stuff here. And I'm not sure how this thing works. I have a couple of things I'm going to want to pop up on it, and I'm not sure how it works.
You just put the piece of paper facing up in front of you as if you were reading it yourself. And you'll have 5 minutes with the clock to my right.
Okay, well, just give me a sec because it's going to take me. You shouldn't start the clock yet. Yeah, no, I've timed things really carefully, so please don't start the clock until I start speaking. I have a few things that I have to get ready, that's all.
Okay.
Just a sec. Sorry. Spent a lot of time shaving this down, shoehorning. Okay. Ready to start, okay? Morning. I'm 66 years old. Everything I know about vaccines I learned in the past 3 years. This means I spent 63 years believing what we've all heard repeated endlessly. Vaccines eradicated smallpox and polio. Turns out it isn't true. Now I'm a vaccine skeptic, vaccine hesitant. I've spent 30 years as an environmental activist doing plenty of research on a variety of issues. I've also, parenthetically, had many a fond illusion rudely shattered. Why am I vaccine hesitant? To put it simply, I did a lot of research and learned much I had not known. What vaccines actually contain, how widespread vaccine injury is, that the vaccine industry was released from liability for vaccine injury back in 1986, that the vaccine schedule went into overdrive after 1986, that there is plenty of science linking vaccines to autism, but not just autism, that my 2-month-old granddaughter was to be given 7 vaccines at the so-called well baby visit, 7 at one time, a 5-in-1 plus 2 additional vaccines, both thighs, 2 months old.
that vaccines are not properly tested for safety, and much more. I also started reading vaccine inserts. I think the best thing to do is just hold this up. And monographs, which come right from the vaccine manufacturer, but which are not shared with patients. I want to read to you from the insert, but I don't have time. Informed consent? How can we provide informed consent if we have not been informed? I learned the true history of vaccines from this book, Dissolving Illusions, Disease, Vaccines, and the Forgotten History, written by a formerly vaccinating nephrologist who began hearing from our kidney patients of health impacts they'd experienced following vaccination, which led her to start digging into the issue in a big way. And her book is the result of those years of research. It describes the filthy, crowded living conditions of the 1800s and goes on to explain that it was not, in fact, vaccines that put an end to disease outbreaks, but the public health improvements made to sanitary conditions. Sewers, clean drinking water, better, less crowded housing conditions. This is how I learned resistance to the vaccine paradigm is as old as the paradigm itself. This is a copy of a photograph taken in Toronto in 1919 from her book, A Rally Against Mandatory Vaccination, 1919, 100 years ago. Farley Mowat wrote in the preface to Never Cry Wolf, quotes, most if not all provincial and state departments of fish and game are little more than Trojan horses of the sport killer lobby. As a longtime activist, I've learned about other places where Trojan horses operate. Regulatory capture is what it's called. Vaccine manufacturers are expected to earn more than $50 billion by 2024. Might be wise to think about Trojan horses. Context. We live right now in a particular context. Erosion of trust in government authorities, SNC-Lavalin affair, spectacular failure of regulatory agencies, Boeing air crashes, lawsuit against Monsanto and Health Canada's denial of research on glyphosate and cancer, feisty young people speaking up about lack of action on climate change, etc., the internet as a force for spreading information that some do not want spread, widespread recognition of the unpredictability of synergies among the dizzying array of toxicants to which we are now all routinely exposed in air, water, soil, food, and vaccines. Sound bites and ad hominem attacks masquerading as news. People lose trust in healthcare when a devastating vaccine injury occurs. It's a fast-growing cohort in our society, given the bumped-up vaccine schedule since U.S. Congress released manufacturers from liability for vaccine injury in 1986. You're considering a report from Toronto's Medical Officer of Health. It says in the summary, vaccine hesitancy is the reluctance or refusal to vaccinate despite the availability of vaccines. Note the language. Read the sentence over again. Note the absence of the words safety and efficacy. An outstanding omission, I think. The implication seems to be that parents should be willing to accept the vaccine program and whatever else the vaccine/medical/pharmaceutical establishment deems reasonable, simply because the vaccines are available. But the very reason an increasing number of parents and grandparents are becoming vaccine hesitant is they're doing their own research, discovering vaccines are not safe and effective. They likely didn't go down that road until they wound up with a vaccine-injured child of their own. It's important to note it's not just autism occurring among our children at epidemic rates.
You're just over 5 minutes, I'm afraid. If you want to wrap up in one final sentence.
Okay, well, kids are, okay. I want to say here, I'm speaking calmly today. Actually, my heart's pounding. I'm not that calm. But the truth is the issue has sickened and appalled me, all the things I've learned. I believe you have a responsibility as our political representatives. If you will do nothing else, I encourage you to inquire into vaccine monographs.
Thank you. You're just well over 5 minutes.
I'm telling you. I will email you my comments because I had to leave quite a lot out. So I will. And I have spare copies of
Any
this,
questions?
if you'd like it.
Thank you. Any questions for Janet? Seeing none, thank you. Our next speaker is Skylar Hill Jackson. Is Skylar here?
Yes.
Pardon me. All the props. Research.
Thank you very much, Schuyler. You'll have 5 minutes, and as you've heard, the clock is to my right.
In my 70 years of life, I've had 3 vaccinations. In the 50s, my 2 siblings and I had measles along with other benign childhood diseases at age-appropriate intervals without any problems, and we all went to school with peanut butter sandwiches. I have 3 children, all born in the 1980s. The oldest 2 received 6 vaccinations each, and according to the 1980s Ontario Public Health Vaccine Schedule, my children were fully vaccinated. In 1989, my 3rd child was vaccinated on a delayed schedule. I had begun to question too many too soon, and the safety and efficacy of vaccines, in particular, the dirty pertussis DPT component. The whole cell pertussis vaccine was used on Ontario babies from 1984 to 1997. The change to the acellular pertussis occurred because there were concerns about safety and effectiveness. In the 1990s, I stopped all further vaccinations for my school-age children. Brand new childhood vaccines were being rolled out, and I did not want my children to be part of a human medical experiment. My youngest child needed a conscience exemption form in her school file. All 3 had the age-appropriate benign chickenpox without any problems, and they all went to school with peanut butter sandwiches. Now my healthy children, all in their 30s, are having their own children. The new Ontario Public Health Vaccine Schedule says that my new grandson and my new granddaughter should have a total of 64 doses of 16 vaccines to keep them healthy, starting in utero to age 18. But they cannot go to school with a peanut butter sandwich. This is because Canadian children today are suffering from a variety of autoimmune diseases like never before. And there are an estimated 40,000 Ontario children on the autism spectrum. The definition for autism is caused by an environmentally triggered brain injury. I taught pre- and postnatal fitness classes to many hundreds of pregnant women and new moms in the GTA for over 20 years. Pregnant women are told no alcohol is safe for a growing fetus. Alcohol crosses the placenta and the fetus blood-brain barrier. In 2015, the Canadian government rolled out a new vaccine schedule for pregnant women. In February 2019, the FDA stated that the U.S. government is recommending untested, unlicensed vaccines for pregnant women. Yes, I am vaccine hesitant. I do not trust pharmaceutical companies which gave us thalidomide, DES, HRT, and currently the opioid crisis. It is my belief that the epidemic of serious chronic diseases in young children will continue to drive vaccine hesitancy. I am an ex-vaxxer. Vaccines are not safe for our children. There are hundreds of electronic database scientific studies by many medical doctors and PhD researchers showing that vaccines are not safe. Canadian public health agencies do not seem to be listening. I am very afraid for my grandchildren. It is our constitutional right to make health decisions for ourselves and for our families. If there is a risk, there must be a choice. Why is it that alcohol is not recommended for pregnant women, but vaccines full of questionable ingredients are recommended? Where are the studies that show that vaccines for pregnant women are safe for the fetus? Why are 23 confirmed measles cases in Vancouver considered an outbreak possible epidemic, but 40,000 Ontario children on the autism spectrum is not considered an epidemic? Where are the numbers showing how many Canadian children are suffering from autoimmune diseases? Where are the science-based studies looking for the cause of all these new debilitating childhood illnesses? Where is the public health concern? Finally, none of what I have said here is misinformation or half-truths, and this is all the backup material to prove it. Interestingly, public health agencies are worried about the effects of marijuana on brain development of anyone under the age of 25, but not on the adverse effects from vaccine ingredients.
Schuyler, your final thought, please.
That was it.
Thank you very much.
Everybody needs to start doing their research because they are
Thank you.
not safe.
There may be questions for you if you just hang on tight. Are there any questions from the members today? No, thank you very much, Skylar.
I'm not surprised.
Our next speaker is Joel Sussman. Joe, welcome. If you want to take a seat at the front, and you'll have 5 minutes again. I'll start your clock when you're ready.
I'll give you a heads up, yes.
Yeah.
I would like to ask where Councillor Cressy might be. I wish to address my remarks to him, as well as the complete board.
If you want to just have a seat, I don't know where Councillor Cressy, he stepped out. But if you want to wait until he returns, I don't know what time he'll be back. But we can also hear from the next speaker if Denise Adele Cook is also here.
Just been made aware that she will not be attending.
Okay, then you would be our last speaker right now.
Okay, well, that's,
You want to proceed?
that's regrettable. I had in particular wished to address the chair, but
Okay.
the choice has been taken away.
Okay, go ahead, sir.
Are you aware that from 2004 to 2014, 0 people in the U.S. died from contracting measles, according to the CDC? During the same time, 108 people died from the MMR vaccine, according to the Vaccine Adverse Events Reporting System. Are you aware that a 2011 study conducted by the Ottawa Hospital Research Institute found that 1 in 168 babies had emergency room visits within 4 to 12 days after their 12-month MMR vaccination, and that several children died during the study? The number of deaths was not disclosed. 1 in 168 is a lot higher than the 1 in a million vaccine injury risk that parents are told about, isn't it? Are you aware the CDC holds 50 patents on vaccines and sells $5 billion a year worth of vaccines? Are you aware that Merck's package insert on the MMR vaccine lists death as only one of dozens of possible side effects? Have any of you read a vaccine insert? Are you aware that the U.S. Congress has ruled vaccines are unavoidably unsafe? Are you aware that vaccine safety studies are almost always conducted by the vaccine manufacturers, and that none of the vaccines on the childhood schedule were tested against a true inert placebo? They were tested against an older vaccine or an adjuvant such as aluminum. Are you aware that pharmaceutical drugs under the FDA are safety tested for an average of 4.5 years prior to licensing? Vaccines are tested on average for 4.5 days prior to licensing. 4.5 days versus 4.5 years. Are you aware that a Harvard Pilgrim Hospital study funded by Health and Human Services in the U.S. revealed that less than 1% of vaccine injuries are reported? This means that more than 99% of vaccine adverse reactions are not reported or acknowledged. Are you aware that the U.S. Vaccine Injury Compensation Program has paid out more than $4 billion due to vaccine injury and death? Are you aware that Canada is the only G7 nation without a vaccine injury compensation program? The CDC uses Institute of Medicine reports to support their claim that vaccines do not cause autism. IOM's 2011 report on autism concludes, quote, "The evidence is inadequate to accept or reject a causal relationship between diphtheria toxoid, tetanus toxoid, and acellular pertussis containing vaccines and autism," end quote. Institute of Medicine's 2011 safety report reviewed varicella, tetanus, hepatitis B, and MMR vaccines. 155 health conditions were studied. In 134 cases out of 155, the literature was inadequate to accept or reject causation. Does this sound like the science is settled to you? If you are not aware of these facts, then you have no business imposing this poorly tested medical procedure on Ontario's children. And if you are aware, then you are participating in medical and scientific fraud. The vast majority of parents of vaccine-injured or killed children now know the truth. They know the science is inadequate to support claims that vaccines are safe. See paragraph above. You will not silence these parents through censorship, shaming, mandates, and manipulation. Until Health Canada authorizes an independent long-term study of vaccinated versus unvaccinated, you are wasting everyone's time. No amount of pressure from Health Canada, Public Health, the Toronto Board of Health, or the corporate control media will ever convince us otherwise. Our trust has been broken. In a 2018 Globe and Mail opinion piece, Neil Rao and Richard Shabazz said this: "The borderline hysteria fueled by the media and public health that greets a few cases of measles is unwarranted." Mr. Rao is a respected immunologist on the staff of University of Toronto. Dr. Shabazz recently held the post of Chief Medical Officer of Health for Ontario. Perhaps you should listen to one of your own. Congress was blackmailed into drafting the NCVIA in 1986. Does everyone know what that is? Just in case. National Childhood Vaccine Injury Act. Vaccine manufacturers were losing multiple big money lawsuits surrounding injury and death of their products. They demanded Congress pass a law to give them legal immunity. In doing so, Congress said you must do safety studies annually and you must report to Congress every 2 years. In a 2018 lawsuit, it was proven that HHS did neither of those things. No studies and no reports to Congress for 30 years. Your science has settled one-size-fits-all agenda intended to lead all citizens down the path of compulsory vaccination is in direct violation of the Ontario Healthcare Consent Act, the Universal Declaration of Bioethics and Human Rights, the Nuremberg Code, and the Charter of Rights and Freedoms in the Canadian Constitution, as supported by a Health Canada statement. This is Canada. It is not Salem, Massachusetts, 1692. It is not Berlin, 1939. This will not stand. Thank you for your time.
Thank you for your time. Seeing no questions, our next speaker is Dennis Adele Cook. Is Dennis here? No, she's not. No, Denise, excuse me. I'm sorry about that. Is Denise here? No, she's not. Are there any other members of the public who wish to depute? Okay, seeing none, we're going to take this into committee. Questions of staff. Councillor McKelvey.
Thank you, Mr. Chair. The recommendations seem largely focused on advocating to Health Canada, the World Health Organization, and other organizations. And I'm just wondering, what is within the City of Toronto's jurisdiction and what can we do? And why aren't there any recommendations around that in this report?
So through the chair, the reason why there aren't specific recommendations around what we do is because that which we do is actually articulated in the body of the report and therefore didn't require specific recommendations. They were also explained by Dr. Dubé as part of her presentation. We were talking about a number of things, so if you refer to the last paragraph of the report, we are talking about examining the evidence to inform a comprehensive multi-pronged strategy that was referred to in the presentation. We talked about investigating various avenues to implement locally measures to mitigate the negative impact of false advertising, things like public health education, healthcare provider education, training with community organizations, and the like. So those are the kinds of things that we would look at here from a local perspective, over and above that which the recommendations speak to, which are at different levels of government, and in one case, refers to an intergovernmental organization.
So you already have measures underway, but you're also looking to expand those as well. And where the expansion, where's that detailed?
Through the chair, that expansion is that's what's referred to in this paragraph, but the recommendations have to do with conferring with partners at different levels of government, at Health Canada. Again, they have a significant role to play in this arena, and as well with the World Health Organization. That's why the recommendations are actually here for the board to endorse, so that we bring the weight of the Board of Health to those conversations, whether we're talking about conversations with colleagues at Health Canada, or whether we're talking about the kind of advocacy that needs to happen at the international level.
So what are we doing or can we do in terms of a public information campaign? So going at the public, a lot of what you spoke about is going after caregivers and in that respect. So what can we do about educating the general public?
So I'm going to turn to Dr. Dubé and see if she has specific comments around our public education efforts and campaigns.
So Toronto Public Health actually has a vaccine hesitancy strategy, though we don't name it as such. So we've given some examples of ways in which we are already working to address vaccine hesitancy. We routinely have a public education campaign supporting vaccines for children in schools tied to the Immunization School Pupils Act. Typically in August, we have a back-to-school checklist for vaccines that comes out. We have information that's in the fund guide. We do a lot of social media and internet communications. So it is part of our ongoing work, which is why we didn't bring it forward as a specific recommendation. And because of the way vaccine hesitancy is being addressed and is changing, at Toronto Public Health, we are changing some of our approaches to address that.
So have we gone, and I think, so Safia said it really well. She said, we have forgotten the ramifications and effects of these diseases, which I thought was really eloquent to the point. What are we doing about that? Like, are we reminding people about polio? Are we reminding people about smallpox? Because it seems pretty nasty.
Yes, I think it's part of our ongoing work here at Toronto Public Health, and I think there's no question that we need to continue to remind people. It used to be thought of, well, people get vaccinated and then they're good, you know, and we can kind of silently keep doing our work. But I think what's very obvious is that we have to keep reminding people that vaccines are necessary, that they work, that this is why we need to keep vaccinating people. And so that is part of the ongoing work that we need to continue to address.
And then two more quick questions. So right now, it seems that it's largely based on the honor system. So I was just filling out forms for my daughter to go to camp, and I had to pull out her yellow form and pull it out. And I admit I had difficulty reading some of the doctor's writing, so that was tricky. But like, what it mentions that, you know, in here that the province is looking at this online system and doing that. What is the time frame for rolling out, and why aren't we advocating for the province to step that up, that online system, because so that reporting is there and we're moving away from an honor system?
Toronto Public Health has been on record before the Standing Committee in 2017, I believe, advocating for a seamless electronic reporting for immunizations from healthcare providers directly into public health system. As I said, there was legislation for that was put on pause, and so we are waiting to hear from our provincial colleagues in terms of what is being planned. There are plans in place, but nothing has been solidified or rolled out just yet.
Thank you.
Next I had Trustee Donaldson, and then just so I saw a bunch of hands. Did I see Dr. Wong, Sue? Okay. Trustee Donaldson.
So I'm the TDSB trustee for Davenport and Spadina Fort York. I've been a trustee for 4 months, and I've heard from 3 different families who have children who are immunocompromised as a result of leukemia, other chronic diseases, and they're wondering about the information in public schools about the proportion of students in a specific school that have not been vaccinated or vaccinated, because to them, school, which should be a safe place, has become rather unsafe without that information. So what kind of information does Toronto Public Health have about individual schools? And if they don't have it now, is there a plan to put that in place?
So thank you for the question. So as part of the Immunization School Pupils Act, students are required to be vaccinated or have a valid exemption. The one exemption I mentioned was the philosophical or religious exemption, but there is also a medical exemption for students who can't be vaccinated because of medical reasons, like going through chemotherapy, and so they can't receive live virus vaccines. And so part of vaccination...
Sorry, I meant, what I mean is the students are coming back into the school. Like for example, their chemotherapy has been done and they're in remission and they want to come back in the school, but the parents are worried about measles outbreaks and things like that.
Thank you. Thank you for the clarification. So vaccination rates in school is something that we have and something that we actually published on our website. We've had a change in our website, and we're actually in the process of republishing vaccination rates for schools with exemption rates as well. And so we definitely want parents to have access to that information so they know what the immunization rates are in their school, because as you know, the higher the immunization rate, the higher you achieve what's called herd immunity, where people who are not protected can gain additional protection from those who are vaccinated. And so we are currently in the process of having that available publicly.
Timing?
Shortly. Like we've been working on this. It's a technical issue. A parent can always call us. We have that information available and we will provide it.
Okay, that's good to know. Thank you.
Dr. Peter Wong.
Thank you, Dr. Dubé, for your report. In the SEAS model, the second step is with regard to convenience of accessing vaccines. My question really is that when vaccines are more accessible and more convenient, we get better uptake, but also when it's inconvenient, it affects the most vulnerable of our population. And the question really what are we doing in Toronto Public Health to make vaccines and vaccine programs more convenient and accessible?
So thank you for the question. We work with, first of all, providers to make sure that they have vaccines, and part of that includes walk-in clinics as well. But Toronto Public Health actually has community clinics that are intended specifically for students who do not have OHIP or health coverage, maybe international students as well, so that they can come, and so there are no barriers to vaccination. The clinics are in the evenings, they're on weekends as well. They're accessible by public transit. We definitely try to facilitate getting vaccination because we do not want convenience or inconvenience being a barrier to vaccination.
Thank you.
Sue.
Because I was saying to Councillor Perks, this issue has been on this board for over 20 years. So this is very, like, old become new, new become old, right? So I want to get some clarification. When we changed the provincial legislation in 2007, requiring those with philosophical or religious reason for that education session, you mentioned it in your presentation. So what percentage of those 1.7% of those change their mind, become participate in vaccination, and that information is really critical. Has that legislation helped in terms of educating our parents about vaccines?
Okay, thank you for the question. So for those who are not aware, from September 1st, 2017, those who choose to receive a philosophical or religious exemption by provincial legislation, the Immunization School Pupil Act, are now required to attend an immunization education session in person at a public health department. And so last year, Toronto Public Health held many of these and handed out 593 certificates. This year, we're continuing to host them, and over 700 certificates have been handed out. To clarify that the goal of the immunization education sessions from the Provincial Ministry of Health is to give informed consent. The goal of the education sessions is not specifically to change minds, just to clarify that. But we do survey parents as they come to the education sessions, a voluntary survey, and ask them questions. And in last year's survey, there were 7% of parents who stated that they had changed their mind about vaccination.
Okay, thank you. So the other piece of the report you mentioned, and I think Councillor Cressy, some of the motions coming forward, the multi-strategy piece, the respond to misinformation. Can you share with the board what jurisdiction, because the social media become the new wave of education, so is there any jurisdiction nationally or internationally holding the social media accountable? Because at the end of the day, this misinformation can be deadly, right? So which jurisdiction is moving out legislation-wise and holding the social media, no different than recent tragedy in New Zealand about the guns and what have you. So can you share with the board about the misinformation and which jurisdiction right now is putting the stop and accountability for social media allowing this misinformation?
It's a very complicated question because the social media platforms themselves don't necessarily have legislation specific to vaccines, though the Canada's Food and Drug Act includes drugs, and vaccines are a part of them, in which advertisements cannot be false, misleading, or deceptive. And so there may be some room in Canada's Food and Drug Act, though Health Canada has not yet used that act for advertisements per se regarding vaccinations. They recently did put out a health alert about naturopaths who were claiming that no-sodes, which is a naturopathic product, is as a vaccine product, and Health Canada was very clear that there are no other vaccine products other than vaccines. The social media platforms, as is listed in the report, have just in February and March, come out with statements recognizing the role that their platforms have played in spreading false and deceptive information on vaccines, and they themselves are taking steps. But In terms of actual legislation, beyond what's in Canada's Food and Drug Act on vaccines, there is nothing specific.
So if I can add to that through the chair, that's precisely why we're making the recommendation that the board requests that Health Canada explore what avenues are available to understand, what makes the best sense, given that it is a very complex regime of legislation and various authorities.
Thank you. Thank you.
Thank you. Kate.
Dubé. I want to go back to the real-time electronic vaccine registry. Are there opportunities, pardon me, to pursue this at the health unit level rather than waiting for a provincial strategy?
Right now, the system is a provincial system. Panorama is our electronic, the digital health immunization registry is what it's called, and that's where the immunization records are housed and used by public health, and that is a provincial system. There needs to be the technological aspect to be able to receive records from doctor's office directly put into the registry, and it is best done from a provincial system because the electronic medical records are not just specific to Toronto physicians.
Yes, through the chair, if I can add to that. So Dr. Dubé quite rightly raises the point that the system that's currently used is a provincial system, and there is an expectation that we use that system. I think the other challenge, of course, is that there is a significant amount of movement within and around the province, which makes a Toronto alone solution challenging at best.
Anybody else with questions? All right, I have a few. I guess I just want to take it back a step here, and I'll direct it to well, whoever sees fit between the two of you. You're both experts. Do vaccines work?
There's no question that, thank you for the question. There's no question that vaccines work, and we've seen actually, if you will, a living experiment, where in places like Europe, which have very similar standards of living to us, the vaccination rates have fallen, largely due to vaccine hesitancy and misinformation. And now Europe is seeing year over year extremely large measles outbreaks where people are dying. In 2019, people are dying in Europe because of measles. And it shows what happens when you stop vaccinating your population for the wrong reasons. People then start getting the diseases, the disease spread, and people get very sick and die. So there's no question that vaccines work, that when you continue to vaccinate, like in a place like Toronto, in Toronto, you can expect that measles is going to come. Measles is spread through the air. It comes into Toronto through travel, and because we have high vaccination rates in Toronto, we're not seeing large outbreaks currently. And so that's another really good example of how vaccines work.
And is there any scientific evidence of serious risk of the immunization program?
There's no question that vaccines are not without risks. And no one is saying to a parent that when you vaccinate your child, it is not without risk. And that's part of the informed consent, that every parent has to realize that when they vaccinate their child, there are risks associated with it. For example, the risk of getting a severe anaphylactic reaction is 1 in a million. That's the same as the annual risk of getting struck by lightning every year. That's why parents must make the choice to vaccinate. But in balance, the risks of getting the vaccine are much less than the risks of actually getting the diseases. Because if you were to get measles and you're a young child, you don't have control over what air you breathe, whether it's contaminated with measles, and you are likely to get a severe complication, for example.
And who is most at risk if immunization rates, vaccine rates go down? Who are most at risk?
People who are most at risk for the severe complications of disease include very young children, including infants. Many infants actually don't receive the measles, mumps, rubella vaccine until 1 year of age when it's provided in the publicly funded schedule. And so up until 1 year of age, they are unprotected and require other people to be protected around them. Those who have a weakened immune system, even if they are vaccinated, can still sometimes get sick from illness, and if they get ill, can get quite sick. Pregnant women, if they get sick, can also get quite sick themselves and can impact their growing child. And so that's another common example of people who can get quite sick. It's the vulnerable who can particularly get quite sick if they're exposed to these diseases.
One of the items in the report, and I will have amendments to it, but is for Toronto Public Health to develop a comprehensive strategy related to vaccine hesitancy and to return here with that. What is the expected timeline? I have a suggested date. When will you be ready to report back with that strategy?
So through the chair, we were anticipating reporting back in the fall.
Okay, thank you. And as it relates to improvements, we're going to come back as part of that strategy related to improvements that the city can take. In your presentation, you spoke to the province related to a real-time electronic registry. Are there other improvements that the province can make as well?
The province has a document called Immunization 2020, and I think there are a lot of really good recommendations in that document that can be reiterated, that if the province were to follow, would be really helpful. One of the recommendations in that document, for example, was that there be a provincial campaign for the public yearly to remind them about the importance of vaccines, for example. And so there definitely are steps that the province can take to address vaccine hesitancy, because it is not a Toronto-specific problem.
Okay, thank you very much. Those are all my questions.
Thank you.
So we're going to move into speakers. I am putting myself on the list to speak first, and then I see Councillor McKelvey and others. I'm going to begin by placing a motion. If it can be put on the screen, and it is being advance circulated, which is to request the Medical Officer of Health and her team to report to our board meeting in September with the comprehensive strategy that is referred to in the report, and to include looking at the following: to investigate the potential for restricting misleading advertising regarding vaccinations on our city's own property, to consult with Health Canada regarding their ability to, just as they do with tobacco, to implement similar restrictions at a nationwide level related to misleading advertising, to ensure that we consider additional actions related to public information regarding the importance of vaccinations, and to support in additional measures we may be able to support other healthcare providers to that. I want to be very clear here. Vaccines work, full stop. That's it. That there is fact-based decision-making, and then there is decision-based fact-making. We at the Board of Health will engage in fact-based decision-making, and there is no debate about that. Immunization has saved more children's lives than any other healthcare intervention in the last 2 centuries. And while in 2019, we should not have to reprove science, in fact, it pains me that we must, just as we should not have to reprove that the earth is round, it is our duty as public health to act, and so we will be very clear and forceful and do just that. Once common and deadly diseases have been eliminated, we cannot let those diseases, whether it's polio or others, return. And others, like measles and rubella, have been drastically reduced. Have we forgotten? When you look at Europe and you look at the States and you see what's taking place, for me, there are simply too many at risk. Importantly, among the most vulnerable, children, pregnant mothers, those who are immunocompromised, that I am not prepared to wait. That this term, if we must reprove science, we will. If we must restrict advertising, we will. And if we need to scale up our work on public health, on public awareness, we will. And so I want to thank staff for their work on this, and that is my motion. Other speakers, Councillor McKelvey.
Thank you, Mr. Chair. I just want to start by thanking yourself and the Board of Health members and the Chief Medical Officer for the work you've been doing in this area. This really reminds me why I did not go into health services, because I just really lack the tact and diplomacy that all of you have shown on this issue. And I just can't commend you enough for that. Also, folks are holding up the inserts that come in vaccines, and so I thought, oh, well, I worked in a chemical lab for many years. You know what, I'm gonna pull up the MSDS for water. You know what, it's 5 pages long. Guess what? First aid measures. If you feel unwell, seek medical advice. Cleanup. Soak up spills with inert solids such as clay or diatomaceous earth as soon as possible. Thank you, as soon as possible. Safe handling. wash hands in other exposed areas with mild soap and water before eating, personal protective equipment, wear gloves and safety glasses, incompatible products, metallic sodium. So I think if we were to look at the equivalent for polio, measles, smallpox, rubella, and all of these diseases, the effects would be much more dangerous, would range many, many pages, and would also say that they can cause death. When I told my husband this morning that this was going to be my first Board of Health meeting and that this was on the agenda, he told me a story he heard on the radio of a mother who had a 1-month-old and had contracted whooping cough. And he almost broke into tears telling me the story of her holding her child in her arms while they coughed and died. And I thought, how am I hearing this story? It's just, it enrages me, and I just commend you all for dealing with this very, very difficult issue, and thank you so much for leading the charge on that. And by vaccinating my children, I'm making other children safe as well, and I bring them there wholeheartedly, and I just wish everybody else did too. So thank you.
Thank you. And for members of the public, under council's procedures, you cannot disrupt a meeting, and I would ask that you consider the committee's proceedings and act appropriately, and you can consider that a warning. Thank you. Next, we have Peter Wong.
Thank you, Mr. Chair. I am also a community pediatrician in the City of Toronto in the neighborhood improvement area, and I am very concerned about this growing hesitancy of parents to vaccinate their children, and I meet this every day in clinical practice. And as the report states, it's pretty shocking that 1 in 5 Canadians are vaccine hesitant. And really, it's this vaccine hesitancy that puts our children and our communities at risk for these preventable diseases, as measles, mumps, and as we've seen from Safia's deputation, polio. So no wonder it is a major health threat, both voiced by the World Health Organization, but also by our Chief Public Health Officer, Dr. Teresa Tam. So we definitely need to support clear and truthful messages about the importance of vaccination, and we need this strong multi-pronged approach to reduce the spread of misinformation and false claims about vaccines. So I believe that Councillor Cressy's recommendations are important in combating this growing public health concern, and so I encourage the Board of Health members to support these recommendations fully. Thank you.
Thank you, Dr. Wong. Any other speakers? Trustee Donaldson.
So this is a really emotional subject. So 10 years ago, I had my first child, and she was stillborn. 3 years later, I had my eldest. And to say that I was under extreme duress going into that first meeting with our physician to have her vaccinated would be an absolute understatement. I think I could probably describe myself as being vaccine hesitant going into that meeting with my physician. And he took a lot of time with me, and we had a really important discussion, not only about all of the potential adverse impacts that come with vaccines, but also the potential adverse impacts that come with not being vaccinated and my child acquiring those diseases. And then we went on to talk about the concept of population health and the fact that it's not just my child, it's all of the children. And so I just wanted to share that, you know, from a parent perspective, there is a lot of stress and there is a ton of misinformation. And so I think really what we're facing here is a communications battle. And so I just want to say that I wholeheartedly support the motion today, and I appreciate everything that Toronto Public Health is doing on this issue. Thanks.
Thank you, Trustee Donaldson. Any other speakers? Councillor Perks.
Probably the strongest memory I have of my childhood is when my younger sister contracted pertussis when she was a year old. She was confined to her room. A nurse showed up wearing a mask, and for 2 weeks we listened to her cough, and labor to breathe. Now, she did survive, but it is the strongest and most powerful memory of my childhood. Just that sense that the whole family was terrified, absolutely terrified. This used to be the way that everyone lived all the time, because these kinds of communicable diseases would just tear through families. If you go look at a graveyard in any city that's more than 200 or 300 years old, you just see all these people who only lived for a year or 2 years, all these tombstones. I don't want to live in that world again, and vaccine, along with other public health measures like clean drinking water, are the difference between that world and the one we live in. And on this issue, we have to be absolutely resolute.
Thank you, Councillor Perks. Trustee Lipretti.
I just wanted to piggyback on Trustee Donaldson about how important communication is. So being here on behalf of the Catholic School Board, if there's any initiative that you want us to bring back to board on how to communicate effectively to our schools, I would be happy to present it. Because going back, we do have a lot of people coming in now that aren't from, English might be their second language. We might have a better way of introducing the concept of immunization to them. And I'd be happy to do that for the board.
Thank you, Lipretti. Okay. Thank you, Trustee. And we'll follow up on that immediately afterwards. Thank you. Councillor Lai.
I wasn't going to speak, but I just want to echo on some of the communication issue here. I think my brother is a victim of polio, and he survived, and we wish that at those days that they have vaccines. And I think there might be some, nothing is perfect, and we, there might be some individual cases that we have to, but I think having heard all these stories actually is quite an eye-opener for me in terms of health, because I don't really know that much about health, but I really think that if, in terms of communication, I think if we can do it in different languages for some of these new Canadians that, English is not their first language, and I just wanted to kind of piggyback on this one, on the communication. And I do support Councillor Cressy's motion.
Thank you, Councillor Lai. Any other speakers? Seeing none, are we comfortable to take the amendment and the item as a package? I'm going to I'd ask for a recorded vote on this one, please. All those in favor?
Trustee Donaldson, for. Cynthia Lai, for. Councillor Kristen Wong-Tam, for. Councillor and Chair Joe Cressy, for. Trustee Lipretti, for. Councillor Jennifer McKelvey, for. Kate Mulligan, for. Councillor Gord Perks, for. Peter Wong, for. Sue Wong, for.
That carries unanimously. Thank you very much. Our next and final item is item HL 4.4, Health Impacts of Alcohol Consumption Update. We do have one registered speaker. Norman, I don't want to mispronounce your name, sir. Giesbrecht, from the Alcohol Working Group, the Toronto Cancer Prevention Coalition, and the Centre for Addiction and Mental Health. Oh, and there's another friendly face. Okay. So are you both deputing today?
I'm just going to introduce Ann Wordsworth. She is the chair of the Toronto Cancer Prevention Coalition.
All right. Well, if you're both speaking, you will have 10 minutes. Many of us know Ann, and Ann, you can always use the mic. So,
is the mic on now?
The mic is on, and the clock, I'll turn on the clock to my right, please.
Okay, thank you. Thank you for the opportunity to speak to you today. I wish to express my support for the March 25th report by the Medical Officer of Health, update on the health impacts of alcohol consumption. I'm also concerned about recent decisions and plans to make alcohol more widely available. These steps have been shown to have substantial negative impacts, increasing health risks, harms, and costs. At the Toronto Cancer Prevention Coalition, our goal is to reduce the incidence of cancer in people in Toronto through the prevention of unnecessary exposures to carcinogen. Alcohol is a known carcinogen, and international and Canadian research has shown that increasing access to alcohol through expanding hours of availability or increasing the number and type of retail outlets leads to increased risk and harm from alcohol. Although alcohol's addictive properties are well known, its potential to cause cancer is less publicized and less understood. Recent research of 17 countries found that with an increase in overall alcohol consumption in a country, there was a subsequent increase in several types of cancer mortality among men. In addition to my concern about increasing the risk of alcohol-related cancers, there are a number of other concerns that I wish to raise. I would like to briefly mention three main parameters which influence access to alcohol: hours of sale, alcohol outlets per capita, in other words, density of outlets, and type of alcohol retailing system. Allowing the sale of alcohol in licensed premises starting at 9 a.m. normalizes the idea of drinking in the morning and may indeed normalize practices of drinking alcohol earlier in the day and in greater quantities. As well, going out for brunch may include family members who are below the legal drinking age and who may be encouraged to believe that alcohol is not potentially harmful. Also, adults consuming alcohol at this time of day are likely to be driving home afterwards, and this may increase the risk of other possibilities of causing harm to others from alcohol. Research from Australia has indicated that when earlier closing hours were introduced, in other words, when you close bars and restaurants earlier, as they were introduced in Sydney and in Newcastle, there was a reduction in alcohol-related harm. Similarly, in Switzerland and Germany, when hours of sale were reduced and other closing hours were shortened earlier in the evening, there was a reduction in alcohol-related harms such as hospital admissions. In short, longer hours of sale make a difference, contributing not only to alcohol-related health and safety risks, but likely also adding to costs related to law enforcement and healthcare services. With regard to the density of alcohol outlets and type of retailing system, there is evidence from BC and Ontario. Professor Tim Stockwell and his colleagues concluded that with a dramatic increase in private alcohol outlets in BC, there was an increase in alcohol-related mortality, hospital admissions, and crime. Research just published last week by Dr. Daniel Myron and colleagues assessed the Ontario experience before and after grocery store supermarkets were allowed to sell alcohol starting in December 2015. They found a sharp increase in alcohol-related emergency room admissions associated with this change. The Myron research focused on an increase of a few hundred outlets, not several thousand. However, the plan by the provincial government to introduce alcohol into corner stores will dramatically increase density of alcohol outlets in Toronto and other parts of Ontario. This will not be good for public health and will increase health care and law enforcement costs. I support the call for an alcohol strategy for Ontario, as noted by the Medical Officer of Health report of 2015. I also encourage the Board of Health to recommend that City Council take whatever steps are feasible and appropriate to ensure that there is no further increase in access to alcohol. Thank you.
Thank you very much. Anne, did you have any comments you wanted to make as well?
No, I'm just here really to support Norman, and because this is a new Board of Health, I was interested in introducing you to the Toronto Cancer Prevention Coalition. We've worked with the Board of Health and with the Department of Health for a long time, and we were originally set up by Sheila Bazrur, the former Medical Officer of Health. And we have 3 working groups. Norman is the chair of our alcohol working group, and we have the Shade group with George Capellos, and he would have been very interested in the heat question that was before you, and then an environmental and occupational health group with Sarah Miller and Ellen Simmons. So you'll probably be seeing us once in a while, and this is our first time before this particular group, and thank you for having us.
Okay, thank you. Any questions for Norman or Anne? I have one. Have you seen the announcement yet that just came out an hour or two ago from the province regarding increasing access to tailgating? No, okay. That I was going to ask for your feedback as it just came out half an hour ago. Then I will, didn't mean to put you too much on the spot, it just came public. There's some push within the city to consider extending the hours of sale of alcohol, both earlier into the morning and later into the evening, particularly for commercial establishments. So on behalf of the working group, is there a position on extending the hours and the potential risks associated with that?
Thank you, Mr. Chair. I think I have already spoken to this extending of hours, but I would add that I was just giving you a snapshot of snapshot of the research. There's very extensive research on the hours of sale, especially having sales late into the night, like 2 or 3 in the morning. And I don't think that there is unanimous support for that. I was at a meeting some time ago where some bar owners indicated that they did not want to be selling alcohol till 4 o'clock in the morning because they didn't want those sort of people who would be drinking between 2 and 4 in their bars. There were also police officers there who were saying they did not want to have that sort of change because they felt this would make life complicated for them in terms of what they would have to deal with. But the evidence I presented is pretty clear that from these studies that if you have a later closing time and then you change it to an earlier closing time, you see a reduction in the several countries that I mentioned in alcohol-related harms such as hospital admissions, emergency room admissions, and others.
Okay. Thank you very much. Any other questions for our deputies? Okay, seeing none, thank you very much. Are there any other members of the public who wish to depute on this item? Okay, seeing none, I'm going to bring this into committee. Questions of staff? Sue.
I read the report with quite a big interest because the data and the summary talk about the increase of the consumption rate for women by 90%. So I want to ask the staff through you, Mr. Chair, that will we be getting more report forthcoming near future? Because this data concerns me about potentially FASD, fetal alcohol spectrum disorder, but more importantly, with the proliferation of the sales of alcohol in the corner stores, what does that mean to our young people? We have 2 represented on the board, on the school boards. And with regard to these recommendations, how do we push out what is our active role? Because this is no different than tobacco. And I love the idea that the board is asking for the province for a provincial strategy. I would even challenge it should be a national, because alcohol is national issue, and there are not just health consequences, but also safety consequences. And I noticed in the recommendation to you, Mr. Chair, to ask the staff that this report not only just go into the traditional route, I would even say the CAA, because this is road safety issue, but also to the respective ministry, because one of the ministry that's not included in the second recommendation is the Ministry of Children and Community Services, because that is the ministry responsible for FASD file, as well as the adult with disability related to drinking has to be included, and as well as the Ontario Provincial Police and the Toronto Police Force. Because at the end of the day, this is not just a health issue, this is public safety issue. How many times we still see people driving beyond the limits? And so this is not a public health issue per se, Mr. Chair, but also I want to ask the staff, as a friendly reminder, this is a public safety concern that we need to make sure everybody's aware. It is not cool, it is not safe, drinking and driving.
So through the chair, thank you for the question and pointing out those issues with respect to the recommendation. As noted in the report, It is our strong position that further increasing alcohol access will predictably increase the risk of alcohol-related health and social harms. There are economic costs associated with that and absolutely public safety impacts. So I hear your concerns around those ministries that have been left off in terms of to whom the report should be circulated, but that was a simple oversight on our part. We're happy to certainly bring up this issue with the other ministries of the provincial government that would have a role to play. I think the other point that I would mention is that you're quite right. There is a national role to play here. The statistics with respect to the increased alcohol consumption came from the Chief Public Health Officer of the country. It was part of her report last year. However, the reason why we're proposing that the conversation happen with the Government of Ontario regarding a provincial alcohol strategy is that they are the ones with their hand on the lever around controlling the system of access. It is a provincial jurisdiction. That's not to say there isn't a federal role. It's just that the control and the opportunity to create an alcohol strategy rests with the provincial government.
Thank you.
Thank you, Sue. Any other questions? All right, seeing none, we're going to move into speakers. Are there any speakers? I will say a few words. And first of all, I will place an amendment, which is to request the Medical Officer of Health to report to the Board of Health at its June meeting with recommendations for the hours of sale and availability of retail sales of alcohol in the City of Toronto. I think when it comes to the sale and access of alcohol, we cannot design policy by the fly, nor should you design policy by slogan. You know, buck a beer, tailgates. I mean, we have to consider the range of implications. And there are costs associated with increased access, both human and financial. And if we are going to do our due diligence as the Board of Health, but also as legislators, we need to consider the full realm of ramifications as opposed to simply the popular slogans. And so I'm happy to move that amendment. And that will conclude my remarks. Any other speakers? Okay, seeing none, we have one amendment. Can we take the amendment and the staff recommendations as a package, or?
Sorry, Councillor, just a quick question. With respect to the availability of retail sales, you're trying to get to the access points of where alcohol is purchased and where it's consumed, is that correct?
As well as the hours of sale in commercial establishments.
And just in light of the I think you just disclosed to all of us that the province is making tailgating now, I guess, a legal proposition. Will tailgating be included into the availability of alcohol? Because they don't sell the alcohol at the tailgating. You're just allowed to bring alcohol into those tailgating parties.
So,
and were you intending to have that linked in together?
So I had written this before the announcement of tailgating, and so I had not anticipated the need for that to be included within it, to which I would ask staff, I mean, we can do it as a friendly amendment, or if staff are willing, if I hear it now, that will be included, I'm comfortable with that.
Could it?
Staff are comfortable to include it in their report.
So then it's the availability of retail sales of alcohol and consumption in the City of Toronto. That would be the intention of the motion, to capture all the minute-by-minute announcements that are coming from the province.
I'm just conscious of the, Councillor Perks is seeking to help me out here, so I'm going to allow him to intervene.
So consumption covers a lot more than tailgate parties. The Medical Officer of Health said she'll think about it. I don't think we need to actually write an amendment in. Fair enough?
That's okay.
Okay, so if I can ask Councillor Perks if you want to come over with the clerks, no, we don't need to write it. They're going to take it away. Okay. So with that, all right, so clarification on my motion, you're satisfied? Okay. Any other points of clarification on my amendment? Councillor Layton?
No, sorry, I was voting.
No. All right. And then, all right, and then we just have a second amendment here. This is an amendment to the staff recommendation, building on Trustee, former MP Sue Wong's recommendation that we also include the Ministry of Children, Community and Social Services, the OPP, the Toronto Police Service, and the Automobile Association to forward this to. So I'd just like to, on your suggestion, we've added that. So with those, can we take all the 2 amendments and the staff recommendations as a package? Seeing yes, Councillor Aiden, you really wanted to vote. He was ready. Okay. All in favor? Mike, go. There you go. Any opposed? Okay, that is carried. That brings us to an end. Do we need a motion to adjourn? No, we don't. Thank you very much, everybody.